Aman, please tell me when we need to start because it's already 8. We were expecting 28 participants, right? You're muted.
We have around 7-8 participants who have joined. Should we wait for another 2 minutes and then I'll start?
Yeah, because I'm not sure whether, because if they come in late, then they'll miss the whole thing. So I don't think we can wait for everyone indefinitely. So maybe
5 minutes.
Yeah, another 5 minutes, and then breakout rooms. Now that if the participants are less, then we can just do it, face to face. That's not a problem because right now, how many do we have? 1, 2, 3, 4, 5, 5 participants. Is that correct? Or
2, 3, 4, 5, 6. Yes, ma'am, around 5-6 participants.
Yeah. So if we have many, then we'll have to need breakout rooms in 5 because expected was 28. So we needed 5 rooms with 5 participants. We may not get all 28. But now that we have only 5, we can do it just, without the breakout room. But if the numbers increase, let's see, we'll just wait for another 5 minutes. The numbers increase, then we need breakout rooms. Otherwise, we'll just do face to face. Yeah.
Yes, ma'am.
All right.
Ma'am, for the breakout room, they're saying that they would have to restart the webinar.
No, but on Zoom, it's easy actually. It shouldn't be difficult. I think it wasn't planned before, so probably that's a problem they're having.
Yes.
How many participants do we have?
3, 4, 5, 6, 7, 8, 9.
So I think we'll start, Aman, because we can't keep waiting.
Okay.
Because it's already 8:15 now, so it's a 1 hour program, right? 1 hour, 30 minutes or something.
1.5 hours, but we already, yes, behind schedule.
Yeah, so we will start, and what we'll do is I'll request all our participants, since we are a very small group, we can switch on our camera so that we all can introduce each other, and then we can start the session. May I request all to switch on your cameras so that, yeah, who is there? Okay. Anyone else? Janani, Shruti, Hima Bindu, Bhavan, Karan, can you switch on your cameras, please? Because we have to interact, otherwise it doesn't make any sense. Yeah, thank you very much. Okay. So the others, Shruti, would you like to switch on your cameras? I know it's very early in the morning. Okay. Okay, in 2 minutes, Janani, 2 minutes. Okay, Hima Bindu, Bhavan, do you switch? Okay, all are looking good, not to worry. Okay. All right. Okay, so this one, because we need to do a little exercise, and since we are a small group, we can do it straight off the platform. So what I'll do is I'll share my screen.
Ma'am, can I take a minute to introduce you to the participants?
Sure. Okay.
Thank you. Good morning. It's my pleasure to invite you all to this workshop on slice model. And it is also my honor to introduce our esteemed guest, Dr. Mary Matthew, whom you've interacted with so far. Ma'am is the head and professor of pathology at Kasturba Medical College, Manipal, and an honorary professor of bioethics at various universities in India. Ma'am was the head of Manipal unit of the International Network of the UNESCO Chair in Bioethics, Haifa, and the Indian program till 2020. In 2021, she was appointed as the head of the Indian program of the International Chair of Bioethics. She has authored several papers in bioethics and moderated 44 webinars on ethical issues in COVID-19 pandemic, organized by the Department of Education, International Chair in Bioethics, Melbourne, Australia. It is my pleasure to welcome you all and hope you have a very interactive session with ma'am. Thank you so much.
Thank you, Aman. I hope we are recording this. Started?
Yes, ma'am. Oh.
All right. All right. Thank you. All right. So good morning, everyone. It's really all of you getting up in the morning. I'm not sure whether you all have classes or not, but we are functioning. So we have classes. I just want to tell you that this workshop that we're going to do is going to be how you are going to handle an ethical dilemma in clinical practice. Some of you are, I presume, majority of you are interns and probably final years. So this comes in very handy when you deal with patients. So the workshop today is on reflective ethical practice using a model which is called as a slice model. And I'll tell you what the slice model is. And after a short short presentation, you'll be doing a short exercise and you'll be sharing it on this platform to everyone. Okay, so that is the way we are going to progress in this seminar, okay, or rather workshop. Okay, now my screen is not moving. Yeah, okay, there you go. So when it comes to ethical decision making, it's very important in your practice. And when you make ethical decisions, you have to reason out why you're making this particular decision when you're faced with a challenge, an ethical challenge. We're not talking about treatment challenges, but we're talking about an ethical challenge. So first and foremost, you need to identify whether there is an ethical issue involved in your particular scenario. Okay, so when you're faced with such ethical dilemmas, you require the skills to reflect. You need to remember that you're also going to tomorrow, you're going to teach another person, probably as a teacher or even as a leader in your discipline, and you have to praise about the ethical decision making. And this is important, not only to manage the dilemma, but also with your interaction with patients and colleagues. So you have to learn to reflect and learn from everyday ethical dilemmas in clinical practice and how to make these reflective ethical decisions. Okay. So this is what I said. This is the SLICE model, and this is the model that they use. This is one of the models which I find useful when it comes to dealing with clinical ethical challenges. So SLICE is structured learning in clinical ethics. Now, if you look at this model, there are all the 5 domains are C's. It starts with a C. But the central domain is a conscience, and I'll tell you what exactly each one is. So from a conscience to a compliance, to concurrence, to conversation, and finally conversion. So this is the way that you're going to go. When you're faced with ethical dilemma, if you can keep these in mind, then probably you may be heading in the right direction. And remember, when you make a decision, it's not always a right decision, but it is the best decision that you can make for your patient. And the ethical dilemmas will change um, with the patient and the circumstances. So the first one we said in the center is conscience. And what is conscience? Conscience is the heart of your moral compass. Now, if you don't have a conscience, then you won't be able to practice medicine, one. And secondly, you will not be able to understand whether there is an ethical dilemma. So you have to understand, is there something wrong in this situation that you're dealing with? So the conscience is actually your inner voice, and it symbolizes your moral principles. And some of the examples are like honesty, trustworthiness, integrity. And much of our conscience is shaped by a cultural, religious, and social upbringing. Another aspect that influences your conscience is role modeling. So I'm sure many of you look up to some people, and there are certain reasons why you look up to people. So role modeling plays a very significant role to impart ethical, to influence your ethical and professional development. So good role models are likely to have strong ethical principles, clinical reasoning, and communication skills. And they are the ones who have happy, committed, and positive junior staff. So if you are a leader, you don't want all your juniors and people under you being very unhappy. So you have to be a good role model for them. The second part is what is called as concurrence. Concurrence is, now we are talking specifically in terms of ethical dilemma. So I have identified, as a physician, I have identified there is an ethical dilemma. Now, what do? I have to think about okay, so the next thing what you have to do, if there is an ethical dilemma, just one. Okay, so the next thing that you have to do when you have an ethical dilemma is make sure that it is compliant with the rules, the laws and rules of the land. Okay, so you can't just make an ethical decision based on your judgment, which you feel is right. But you also have to see if there is any medical legal issues associated with this dilemma. So why is it important? This one, it is important for you to have a good safe practice. Okay, so medical, if you are aware of all the medical legal laws and regulation, then you will have a sound practice. The other reason is it protects the patients from unlawful practice. So they shouldn't be subjected to something that is unlawful. And the third is, if you're complying with the medical legal issues, then you can maintain the public trust within the profession. Now, once you've identified your ethical dilemma and you look up all the medical legal issues with your medical with the laws of the land or medical laws, okay. The next step is concurrence. What is concurrence? So we had conscience, we had compliance, and what is concurrence? Concurrence just means acceptance of or respecting the other person's moral viewpoints. And many times as doctors, we think we are right and our moral values are better than the others. But remember, you're dealing with a patient, so you have to accept their moral viewpoints also. It's not only our moral and religious beliefs, it's also the religious beliefs of the patient that you are dealing with. So you have to respect and acknowledge religious and cultural beliefs and values. But there is something called as conscientious objection. What is this conscientious objection? You probably would have studied in forensic. Conscientious objection is something that is really drastically wrong, and you object to it. That is what is called as conscientious objection. So I'll give you an example. Suppose the patient says, "Doctor, I don't want to live anymore. Please kill me." Would you do that? No, you can't do that. Okay, even though the patient wants it, you cannot do it because one, legally, medically, it is wrong. Two, by default, we as doctors are programmed not to kill, but to save lives. Okay, so once you're aware of the medical laws, laws of the land, legal laws, you have to look at the patient's point of view, their beliefs, their cultural values, and you have to respect them. The third is conversation. Okay, when there is an ethical dilemma, it's very important for us to, as clinicians, as doctors, to discuss the different ethical viewpoints without imposing our own. It's not theirs, our own to the others. So this, when you have a conversation, this is where your active listening skills and empathetic skills come. So if you are not used to listening to patients, and if you do not have empathetic skills, then it will affect your communication and interpersonal relationship. So very important as a doctor to develop the art of listening to your patient and being empathetic. Okay. Now, where there are divergent ethical views, like my views are different from the patient's views, you have to have a conversation, which of course these are all sensitive conversations, which are neutral and non-judgmental. Many times, in our mind we'll be thinking, oh, what does this patient think? Do they think that they know everything? Many of them will Google and come and tell you what to do as a doctor. So these are things that you have to keep in mind and be non-judgmental. Otherwise, we cannot have an effective dialogue. Okay. Now I'll give you an example. Suppose there's a patient who wants a female doctor when one is not available. What will you do? Now think about this ethical dilemma. Patient, you're a male doctor. The patient comes to you and says, "No, I don't want to be seen by you. I'm not comfortable. I want to see a female doctor." Would you take offense? That is what is important. How would you deal with such a situation? So the last thing is conversion. So what do I mean by conversion? Conversion only happens when you have followed all the previous 4 steps. That is, if you have applied appropriate conscience, compliance, concurrence, and had a conversation, and you're able to accommodate the other person's viewpoint, then, and while trying to enlighten them to other possibilities, that is what is conversion. Okay, so I'll give you an example for conversion. A patient is coming to you saying that he or she doesn't want any more endoscopies because the other other experience, previous experience regarding endoscopy have been very distressing or painful. Okay, so imagine, forget endoscopy, if you were to even have a per rectal examination or a per vaginal examination, there are many patients who will refuse. But you know that these are, part of the examination that are required. So how would you come to how would you probably explain to the patient and make them understand why it is important? So these are some of the ethical dilemmas that we face. So keep in mind these 5 domains of the slice model, and this will help you navigate your way through an ethical dilemma. So I'll give you certain examples. Okay, so this is an ethical dilemma where a baby has died. I'm a pathologist, so I deal with a lot of autopsies. So this is an ethical dilemma where an autopsy has to be done on a baby who is born stillbirth. It's a still born baby. Now, you need to do an autopsy because probably this family has had a series of stillbirths. So obviously there is a problem. So how would you convince the parents to have to accept an autopsy? So we are going to go through these 5 domains. So the first thing your conscience tells you, it should tell you that, see, the parents are grieving. They are at a period where they are grieving, and we have to give adequate time to accept the bad news. So suddenly when the baby dies, you go and tell them, no, you need an autopsy, otherwise we will not know why your baby died. See, that is something that is not, acceptable one, and that is not the correct way. You have to remember they are grieving for their child, so you have to give time. You have to explain what is the need for doing an autopsy. That is where the heart of the slice domain comes in, that is conscience. But before you do an autopsy, you have to think about what are all the medical rules and the laws of the land regarding autopsy. So then you have to get, first and foremost, you have to get an informed consent. That is must in any autopsy. So you have to know the rules and regulations regarding obtaining an informed consent, and how do you get an informed consent. Then you need to know the sections 174, 176 code of the criminal code of penal code for medical legal autopsy. Otherwise, you can't just go do an autopsy. So once you know the medical legal aspects of autopsy, you are moving into concurrence. So what is concurrence? You have to respect the patient's views on autopsies. Okay. Now, remember, there are certain religions that do not allow autopsies. So you can't go and tell them, force them, no, you have to have an autopsy. Otherwise, you'll never know why your baby died. So what else can you offer the family? Instead of a full autopsy, can you go ahead with something called as a limited autopsy? Would that be acceptable to them? Would it be accepted in their cultural belief, in their religious belief? The next is conversation. You talk to them, communicate with them the need and the benefit for a complete autopsy, because you need to know the exact cause of stillbirth and its utility in subsequent pregnancy. Suppose there is a chromosomal anomaly, then you need to have a genetic analysis of the baby, the parents, and the siblings. Suppose there are inherited defects in the baby, then it may affect subsequent pregnancy. So you need to convey all these information, and there is something called as informed refusal. Parents may allow all these tests, but they say we don't want to know the results of the test. That is what is called as informed refusal. And of course, the main thing when it comes to autopsy is regarding cremation or burial. Okay, so different religions have either cremation or burial. So there are some religions will have different. So one of the, at least in the Hindu religion, you have to bury the body before the sun sets. So you have to do your autopsy prior to that. You cannot do after. So all this conversation should take place between the parent and you as a doctor. And conversion is allow patients to consider the alternatives for autopsy. So if they are not willing for a complete autopsy, can you do a partial autopsy? Can you do something which we now go, which is called minimally invasive tissue sampling? That is, you just take, with the help of a needle, you take a core biopsy of the relevant organs, like from the brain, from the lung, from the liver, which will help you at least come to some sort of diagnosis. So this is where you use the slice model. One more example. This is an example where you have to, a doctor has to put a percutaneous endotracheal or gastric tube in a patient with dementia. Now, how are you going to go through all this? So first and foremost, your conscience should tell you, does this patient actually need it? That is what is more important. Oh, yes, the patient has dementia, and because of the dementia, there will be difficulties when it comes to feeding. The patient can go in for nutritional deficiency. Now, remember, all this when you look at these kind of cases where patients are demented, you need a multi-professional nutrition team to come in and help wherever possible. So keep that in mind. And you have to prompt and timely decision. Now, what is compliance? Are there any rules regarding dementia and, rules regarding decisions regarding nutritional support for the patient? So there is the Mental Capacity Act of 2005, which talks about what you do in case of patients with dementia, and can they give a consent? Can a demented patient give consent? Do they have any advance directives in case something happens? Who has the power of attorney for this patient in case something goes wrong? All this you have to keep in mind. Then comes to concurrence. You have to acknowledge and respect the patients and family views on insertion of this PG tube. Do they want it? Sometimes in a family, you'll have, groups of people, some people saying they want it, some saying they don't want it. So you have to find ways of talking to them, have a conversation, communicate with the patients, the caregivers, the family about the risk and benefits and alternatives to PEG feeding in a demented patient. And as far as possible, as a physician, you have to have a balanced or neutral viewpoint. You have to empathize with the family when discussing about this. And if suppose they're not willing, are there any alternatives? Always look for alternatives. You can't say, no, this is the only way out of this situation. So what is the alternative? If you can't, if they don't want PEG tube inversion, the other alternative is, can we hand feed, which you have to tell the caregivers is very tedious and difficult, or can we give some certain oral modification that could help in feeding? Okay, so once you give these alternatives, also give them time to the family to consider these alternatives that you have provided, and you should be able to negotiate sensitively around all the information that is given regarding the nutritional support. So this is the conversion phase of this slice model. Okay, so now what I want you to do is, you have this is the worksheet that you have. You have to put in your ethical dilemma on top and work your way through all these 5 domains: conscience, compliance, concurrence, conversation, and conversion. So I want you all to write this down if you have a laptop, you can make it on a laptop and share the PowerPoint with us. Otherwise, we can just go through it one by one. So this is what I want you to do. So just write down this, put your ethical dilemma, and then on the left side, write these 5 domains, which is conscience, compliance, concurrence, conversion, and conversation, and conversion. Okay, so let me just stop share. Okay, so have you all understood what I've said?
Yes, ma'am.
Yeah. So how many are we now? We are about 18 of us. But then I think 3 of us are part of the main team. So, correct? Yeah?
Yes.
Okay, so how would you like to go about it? Would you like to do it on a PowerPoint and share, or would you just like to discuss the case? Would you like to put an ethical dilemma and discuss the case individually, or would you like to make it on a PowerPoint and share? How would you like to do? Anyone? How would you like to do it?
Ma'am, in the comments, someone has said discuss the case.
Yes, you can discuss the case, but you'll have to put your ethical dilemma. Put your ethical dilemma and go step by step. So, did everyone understand? Yeah. And then one by one, you can all present your cases. Is that okay? Is that okay? You can put it in the chat box if you have
Yes,
any
ma'am.
problems or so I presume all of you are final years and your interns. Is that correct? Is that correct? Or do we have anyone who's not exposed to the clinical clinics? Is there anyone who's not been exposed to clinics? Can you put it in the chat box? Yeah. No? Okay. Your first year. Okay. Janani is also first year. Are you first year? Third year. Okay. So Janani is third year, but then you would have gone to clinics. Just put in one dilemma that you have faced. Okay. Don't make it a scientific dilemma. I'm talking about a ethical dilemma. Okay. When you faced a patient, what was the ethical dilemma and how you would use these 5 domains to come to a best decision for the patient. Okay, is that all right? So what I'll do is I'll give you 15 minutes. Amin, is that okay? 15 minutes.
Yes, ma'am.
15 minutes, and we will come back again. Okay, and we will discuss. Okay, so just to tell you, this is very informal. Don't worry about what you're saying, but we will discuss and see if we can come to a decision regarding your ethical dilemma. So you can also use the Google and see if there are any medical legal laws of the land which pertains to your ethical dilemma. Okay, is that okay? Yeah. So yeah, so I expect that all of you should take part. Please don't just switch off your cameras and sit behind the thing, because it is a workshop and you have joined for a reason. Okay, all right. So I mean, I'll be switching off my video and camera. I'll come back at 9 o'clock. Is that okay?
Yes, ma'am.
Done? Okay. Ma'am, can we get some cases to, okay, Hema Bindu, are you a medical student? Sorry, are you a third year or a final year student?
You're
You can write.
muted, Hema Bindu.
You're muted, or if you want, you can write it in the chat box.
Ma'am, I'm a community medicine postgraduate student.
Okay, I'm sure you would have experienced some ethical dilemma when you went into the community, right?
Yes, ma'am.
Because that is relevant for you. See, if I can give you a clinical case, it doesn't make any difference to you. So
Okay.
think about what has happened, in your in community medicine, and see how we can best solve it. That would be a better way to apply this, what you've learned from the workshop.
Okay, ma'am.
Nothing is small and nothing is silly. We can discuss everything. Okay.
Great, ma'am. Okay, ma'am.
All right. So 15 minutes, 9 o'clock, we'll all be back. All right. So
Okay,
let's
ma'am.
make this a little interesting.
Has everyone completed the exercise? If anyone could, like, in the reactions, put a thumbs up if you finished the exercise.
I think we can start. Would anyone like to share? Dr. Karan, would you like to start? You're muted. Yeah. We can't hear you. No. What you can do, Dr. Karan, is not use your headphones. Try and see without it. Just unplug and see if we can hear you.
Okay, can you hear me now?
Yeah, correct. Dr. Karan, just please introduce yourself so that everyone knows.
Hi, I'm Dr. Karan. I'm actually a dental surgeon by profession, by degree.
Okay.
However, during the post-COVID pandemic, I was also assisting at a COVID care facility, and I was helping around with that.
And you're from where, Dr. Karan?
I am from Mumbai. I studied at Nair Dental, Nair
Right.
Hospital Dental College.
Okay. So do you have an ethical dilemma? Do you want to share screen or would you like to just speak out?
Yes, ma'am. I am just trying to give me a minute.
I'm going to just see if Dr. Karan has rights to share. Yes, you have. There you go. All right. That is a long ethical dilemma. Okay. Right.
No, so the dilemma is actually down. I just wanted to give a little background to the story.
Okay.
Okay, so basically there was this one elderly patient who in a proper hospital at the time was admitted with chief complaint of a hip fracture. And since it was during the COVID-19 pandemic, it was a very routine thing to screen the patients that get admitted. The hospital being a non-COVID hospital, they screened and unfortunately she did turn up positive. So because it went against their rules, she was eventually transferred to a makeshift hospital. Uh, the problem with the makeshift hospital was that it was a dedicated COVID hospital where there wasn't any orthopedic consultant or somebody with that level of expertise available to treat her primary complaint, to the utmost attention that it may have needed. So, however, still the doctors, adhere to the basic principles of first aid and management, and they tried and provided her with whatever stability was required to stabilize the fracture during the course of time. And they simply hoped that she would turn up negative soon enough that she can get the deserved treatment. Unfortunately, she was very aged. She was obese. She had a lot of comorbidities, and none of this played on her side because she was turning up positive with any regular tests that were being conducted on her with regards to SARS-CoV-2. And almost 3 weeks in, the doctors decided that her primary chief complaint needs a little more attention than they earlier had anticipated, and they simply could not wait for her to turn up negative. So surgery definitely being out, she needed much more vigilant attention, and so the family was contacted to send, to arrange for getting her transferred to a hospital that was willing to accept a COVID positive patient and also having provisions for an ortho department. Uh, Unfortunately, for whatever reasons, the family was unwilling to do that, and the family actually suggested that they stay right where she is. Initially, the conversations were relatively more polite until it started getting a little more heated because we simply couldn't understand why they weren't willing to transfer the patient out. And even if we got a consultant to come in and check in on her or anything, it actually turned into far bigger drama because they just refuse to let that complaint of her become, to get treated for some reason or the other. And because they turned up to be somebody having quite some political power with them, even the higher ups weren't getting too involved with this situation. So the ethical dilemma that this basically posts is that people realize that this is out of their scope, and that this needs. I mean, the patient needs far more attention because they no longer are going to be able to benefit the patient, and rather they're causing more harm. By keeping her there. Uh, Still, after realizing all of these ethical dilemmas, due to system, due to family drama, whatever may have been the reason, not being able to help the patient was posing a conscientious bite on all the doctors involved.
Okay. So no. So Dr. Karan, just give me the ethical dilemma and let's work our way through this.
Okay, so what do you do when the system is willing to help? However,
No,
the
what is your
patient who
ethical
was
dilemma?
relevant.
What is your ethical dilemma?
Basically, what do you do when there is a refusal to accept treatment which is
Who's
needed?
refusing? Who's refusing?
Either the patient's family, basically the
Family. So, okay.
representatives.
So you have an elderly lady who has a fracture and who has, is she of sound mind? Is she okay? I mean, she's conscious and she's able to take
She
decisions.
was at the time. Yes, she was. She was conscious and she was very much aware about her situation.
Okay. All right. So you have a conscious patient able to give consent, able to take decisions, but your
Yes,
problem, and she needed to be treated for the fracture. In between, COVID came when she was put in COVID facility.
yes,
Her family is refusing to treat the fracture, correct?
yes,
Yeah.
yes.
So that is your ethical dilemma. So what is the conscience? What is your moral compass, and what is it that is troubling you regarding this case?
Uh, so basically, what was troubling was that the family. I mean, the patient did need far better attention than we could provide them.
Okay, so
Provide her
doctors
rather.
willing to provide the treatment, but family refusing.
Yes,
And you
yes.
felt that the patient, I mean, it's not like a futile attempt, right?
No,
It's not a futile
it,
that the
it went
patient
on
will
for a month.
survive. Yeah, all right. So what is how will you, when you put the second aspect of it, that is your compliance, are there any medical legal rules that talk about, um, uh, uh, the first is patient, remember, medico legally, the patient is able to consent for a treatment. So ideally, you don't really require the family's consent, but it probably will be complicated because the finance and the money may be coming from the family, correct? So obviously they have powers over the patient,
Yes.
correct? Yeah. So is there anything medico legally that you can look into? What is it? Suppose you treat the patient. Suppose you treat the patient against the family advice, but
Hmm.
but the patient is willing.
Oh,
Would you get into any legal complications? Is there anything like that that is what you have to look into?
okay.
Okay.
So,
So
uh, yeah, we were trying to look into that. The only this thing is that uh, the family being having some sort of a political background, that as well was causing quite a lot of hurdles.
yeah, because they are refusing treatment, patient wants treatment.
Yes.
Correct. But your obligation as a physician, as a doctor, is only to the patient and not to the patient family. That is important.
Okay. Okay.
Okay, right? So then
Yep.
this conversation you are having, you should now the problem is not the patient, the problem is the family, right?
Yes.
So the conversations that you're having is turning out to be very difficult because you've understood that they refuse treatment. They don't want to treat the patient. So obviously there is
Yes.
something more than what is on the surface. For some
Yes, yes.
reason, see, in India, there are a lot of issues that you always have to look into when it comes to elderly patients, especially when children are looking after. There is the issue of property, there's the issue of money, there's the issue of, who's looking after, whether it is the daughter, the son, all that, it's a very complex situation, right?
Correct,
Now,
correct.
if the finance is coming from somewhere else for the patient care, um, uh, did anyone initiate any conversation with the patient regarding the treatment?
Yes, we did. So the thing is that, I mean, the patient was open to it and she understood the fact that she needed, she needed to be transferred. In fact, there were actually times when she herself said that you can tell my family that I won't, I'll do exactly what they tell me to, but let me get the treatment that I need.
Okay, so this is a very common scenario that you see in India, conflict between the family and the patient. But
Correct.
obviously, she's dependent on the family for
Family.
finance. Yeah, for finance and for care. So this is where this is where your skills of empathy, of talking to the patient, of talking to the family becomes very important. Now, in a family, there is always someone who is a little more pliable, a little more softer. So how you deal with it is you have to, engage everyone, but you have to find out who's the one who's more favorable towards the patient, correct?
Okay.
But what happens is sometimes even the patient who is favorable to the patient is not in a position to provide finances for the patient.
Hmm. Hmm.
So that is the story now here. Now, what happens is in this complicated situation, you want to treat the patient, but the family doesn't want to. Now, you have
Correct.
alternatives to take it in a legal route, okay? Or you have an alternative to, provide finances for the patient instead of the family.
Okay.
So these are the other routes that you can probably look into when it comes to treating a patient. And these are difficult. These are actually very difficult, and at times when it involves politics, it becomes a dangerous situation. So you need to also protect, but obviously doctors want to do the best. So you have see, in these kind of things, a junior doctor should never take a decision. It should always
Correct.
be with the help of either the medical superintendent or someone else in power who can take the decision. So that is what is very important. So your job is actually to engage people in power in the hospital who can take the decision. Because as a junior doctor, you probably will not have, and you will not command that much of, you won't be able
Correct.
to do a lot of things. So this is see, you have to ideally go through all these steps. Okay, and
So we
at the end, you have to take a decision which you feel is right for the patient. But sometimes you don't know. You're stuck. You can't do more than this. So what you have
yeah.
to do at the end, having had all these conversations and having accepting the patient's view, you have to document it. This is what I want to tell all of you. Document everything so that if taken to court, you have proof that all this was discussed. And in case the patient dies, because tomorrow if the patient dies in your care, the family will definitely blame you. So this is where the importance of documentation comes in. So having attempted all these, you've gone through all this, sometimes the way at the end may be, just a dead end for you. But you have gone through all the processes. That is what is very important. And at the end, you have to document. Ultimately, you have to do it legally. And ultimately, you have to document that patient willing for treatment, however, finances and patient party not willing for further treatment. Okay, so
Okay.
that's the way.
So,
So how did you handle this, Dr. Karan? Finally, what happened?
Ma'am, eventually, so like you mentioned in between, we did involve the management and the senior doctors into it. They gave their try as well, speaking it out with the patient's family, and getting a hospital. In fact, they even helped us arrange for a hospital.
Okay.
However, because of the stubborn refusal from the family side, even they eventually raised their hands. So in such a situation, even when we document, I had that other dilemma. I mean, eventually, it also does expose that the management probably did not take the necessary steps that was within their realm of power. So, I mean, that again does not sit well between a junior and a senior.
No, what I'm saying is every doctor who has attended the patient or has taken part should document.
Okay, okay.
That is very important. That shows that they have taken all the steps in their
Okay,
capacity to convince. Because what we say can be anything, but unless you put it down on paper, it is of no value. Because
okay.
you can say, see, I
So,
told you, to do this, but you never did it. That's okay while saying it. But if you have not
yeah,
documented, it's of no use. So you
okay.
have to, legally, you also have to take steps to protect yourself.
Okay.
So that
So
is the way.
eventually sorry. So eventually the patient, basically after staying in our care for almost 2.5 months, uh, she underwent a cardiac arrest and she eventually died.
Hmm. So
So,
hopefully nothing happened in terms of patient party not, blaming the doctors.
they had in fact alleged that if you try and pursue transferring her any further, then we'll put false allegations against you all, which is when
That's,
all the doctors also raised their hands.
yeah. So obviously they wanted her to die. There is more to this than,
It was, yes, it was a clear case of abandonment. That is what
yeah,
we realized.
yeah.
Uh, but I mean, simply we couldn't figure a way out, and
Yeah,
eventually it
some
started
things
biting our own butt.
you can't, because in India, the political, there's a lot of political interference in medical treatment. But at the end of the day, you should also make sure that you're safe. And this is where documentation comes in and helps the doctor. Okay.
So,
All right. Very good. Thank you, Dr. Karan. A very
thank you, ma'am.
interesting
Thank you,
case.
ma'am.
Yeah. Yeah. Kuhu, would you like to go next?
Yes, ma'am. Good morning, ma'am. I'm
Yeah.
Kush.
Introduce yourself and yeah, sorry.
I'm a final year student. I study in Devas, MP, but I'm originally from Gwalior, MP.
Okay.
So I'm lacking a few points in between. Please help me
No,
with it.
we are going to do it together. So everyone can help
Okay.
Kuhu in the dilemma that she has. Okay. So it's a workshop. We will all find solutions to the problem. Okay.
So my dilemma is a patient is brain dead, and we have to tell the family that we have to halt its normal his life support.
Remove the life support. Very common. Okay. Right. So
So
go through the steps, Kuhu, and then we will.
So the first point, conscience. I'll have to, we have to tell the family that you can take some time if you want to with the patient, take in the news and accept what has happened, and then we can explain them why the patient is dead, even though they can see that the chest is moving and the body feels warm.
Okay.
Then we have to explain them about organ donation and how it can be beneficial for others.
Yes.
I couldn't find any laws pertaining to this.
There are. Okay. I'll tell you. Okay. Okay. So your patient is brain dead, correct? Very common after an accident. You'll see a lot of young people brain dead. You put them on the ventilator, and then the parents come and see. I had an experience because my own nephew died like that, and the parents said, the heart is. I can see that he's still warm. His, he's breathing. I can feel that he's not dead. Why do you want to take him off the ventilator, right? So this is a very common problem. Okay. All right. Now, what is the law regarding, everybody can help in this. Is there any law regarding removal? I mean, taking a patient off the ventilator? Can someone Google or, check and see, are there laws in India regarding removal of life support? Because this is a common problem. It is unusual that we do not have, a rule regarding that. Can anybody help out on that? Can you all switch on your camera so that I know you all are there? This, it will be only Kuhu, me, and Karan who are, discussing this. Okay. Okay. Anything? Have you come across it? So if you, there is one case who I wanted to tell you, there is a case regarding, a young nurse who was in a KM hospital who was raped by one of the attenders in the KM hospital. And she was put on a very long life support, and all because she was a nurse, all the nurses wanted to keep her alive. They said they will take care of her, and she lived quite a long, I think about 25 years on that life support. And not only life support, she was actually being fed and looked after. So that is when the Supreme Court made these new rules in India regarding, when are you going to remove a person from a terminally ill, or when are you going to remove a person who is in a vegetative state from the life support. So this is where issues regarding euthanasia comes in. Active and passive euthanasia. So India has put out laws regarding euthanasia. So there are certain rules and regulation and regarding patients on life support, when to take it out. Even
ma'am, I found an article which talks about this. May I read it out?
Yeah, please. Who can you introduce yourself also, so that we are all?
Yes, ma'am. Ma'am, I'm Dr. Himabindu. I'm a first-year postgraduate student of community medicine at DMIMS Wardha.
Okay.
Ma'am, so paragraph of this article says, this was published in 2011, and the paragraph goes, a recent judgment by the Supreme Court of India legalized withdrawal of life support measures in patients on vegetative state. Such a decision to discontinue life support measures can be taken by a parent, spouse, or doctors attending the patient in the best interest of patient. However, it requires approval from the High Court, which can grant the permission of withdrawal of life support to an incompetent person. The court appoints a panel of 3 expert doctors to seek its medical opinion, preferentially one neurologist, one psychiatrist, and the other physician.
Okay, so that's very important. There is a team that decides, when it comes to patients who are on life support, when to remove. So it is not it's not only the individual physician's decision, it is a team that decides. So this was, the case was the Aruna Shanbag case. You can go back and you can Google it, regarding euthanasia and passive euthanasia, and when can you do it. Of course, active euthanasia cannot be done. You can't voluntarily go and kill a patient or take withdraw life support when the patient is conscious and those kind of things. But there are rules. So having known the rules, how would you proceed now, Kuhu? Because the next, after your conscience is, you have to tell them the patient is brain dead. And remember, patients are grieving. These are delicate situations, because they do become violent when when they lose someone. So that you have to always keep in mind. So that empathy and gentleness should come in at that stage. And then you have to realize there are laws and rules regarding when to withdraw from life support. Now, having said that, what is the next step that you move on to?
Now understanding the I could explain the patient's family that we'll need 3 doctors, and 3 expert doctors will be telling them that the patient is actually dead, and
Yeah, correct.
then they might need time, the final time to spend with a family member who
Exactly.
has been in. So we can provide them some time alone,
Yes.
and then we can also respect their choice to accept or decline the option of uh, like organ donation.
Yeah, so this is where we should always be careful. Suddenly, when a patient dies, in our, we want to be very, we feel altruistic, and we say, no, why don't you give your organs, your child's organs, to, it'll help 3 other people, 4 other people. But there is a time and place to say all these things, and the time is not immediately when the patient dies. You have to allow the patient party or the parents to grieve, and then slowly, break this news to them. And this is usually done by trained personnel. There are people who, who are trained to approach parents with, to talk about organ donation. So, as a junior doctor, it may be difficult for us to, go and tell. But it's always, of course, senior doctors always have experience. So. They may be able to do it, but as a junior doctor, we can't go and just say, okay, you're going to do good by giving lungs and your heart, the eyes and all, because they're still grieving. So that is important. Have the conversation, and then what would you do?
Ma'am, I could suggest him for, or ask a psychiatrist for a grief counseling.
Yeah, psychiatrists should come in. Psychologists should always come in the picture. Especially when parents are grieving, and they need to talk, they need to hear also someone speaking about. So that is important. But if they refuse, you have to respect that decision.
Yes.
You have to respect that if they don't want to donate the organs, you can't say, oh, you're depriving someone of 3 lives and 4 lives, and that's not right. But if done very well, then you may be successful in this thing, what is it, getting the organs for donation. Now also remember, religious practices and beliefs are different in different states, in different religions. Okay, like I said, before the sun goes down, certain communities require that the body be buried. That also you have to keep in mind. So you can't keep the body for very long, and it's and disrespect the cultural values or the beliefs of the patient. Very important, especially when a patient is dying, to think about religious beliefs. Okay, all right. And then of course your end is, if they do accept for organ donation, good. If they have to come out not feeling lost out of the whole situation, because they're actually, there's a loss, but still they should feel that that everything, all the processes have been done smoothly. That is very important. Okay.
Yeah.
All right. Thank you, Kuhu. All right.
Thank
Anyone else who wants to come in for a case?
Ma'am, may I present my dilemma?
Yeah, Hima, you. Yeah,
This
community
is a
medicine
short,
is still, Dr. Hima Bindu is in community medicine. It's full of ethical dilemmas. I'm surprised that you
ma'am.
asked for a case.
Ma'am, actually, there are so many dilemmas, and none of them are as big as euthanasia. So I wasn't sure
No, there's
which one
there's
to
nothing like a
take it.
big good ethical dilemma and a small dilemma. Ethical dilemma is dilemma. Okay.
Right, ma'am.
Yeah.
Ma'am, so the one that I've picked is from vaccination of COVID that was going on last year.
Yeah.
So
Relevant.
this happened during phase 1 of vaccination. So in India, the phase 1 was for healthcare workers, frontline workers, and people above 50 with or without comorbidities, and under 50 only if they have comorbidities. So not many such cases happened, but the first time that it happened was, now what happens in community medicine is I joined just when COVID had started. So my duties were first our associated sub-centers, primary health centers, UHTC, RHTC. And once the vaccine came, the vaccination centers were also part of our duties. So what happened was when the vaccination started in our college, we started sensitizing the people in the RHTC and UHTC to come over here and receive the vaccination, but only those who fit into those categories.
Categories, yeah.
So, one of my duties, what had happened was, there was this family who came in, and I knew this family because I had been seeing this family in RHTC for the last 2-3 months. They come regularly to get the hypertensive medication, which is given free at our RHTC. Now, there was a elderly lady who was in the above 50 category, so definitely eligible for vaccination, and the caretaker, her son and his wife. So the son did not have any comorbidities. The wife had the comorbidities. So we have 3 people, 2 of them who are eligible, and the third person who brought them, the man who brought them, is not eligible. But what happened was, when he came in, he saw that there were a lot of people receiving the vaccine across various age groups. So he didn't realize why he didn't fit into it. I mean, he knew the everything that was going on, but still he had this thing that, why can't I receive the vaccine? I'm bringing people in and the vaccination is happening right over here. You have the doses. So how is a small injection going to harm you guys? So please give me the vaccine. And at that point, so that was my dilemma at that point, because what he was saying was also making sense to me, because that was a period when we had 2 groups of people. One group who desperately wanted the vaccine, but who were not in the category. The other group who fit the category, but were showing a lot of hesitation towards vaccine. And we had to convince them repeatedly that this is good for you and good for the community. So please come forward and take the vaccine.
Yeah.
So this was my dilemma. And conscious, the part of it was, I knew the rules. I knew phase 1 who had to
So
receive the
compliance, you
vaccine.
knew that you had to stick to the rules, right?
Yes.
Yeah.
Yes. So I was a first year, and I knew the rules that had been given to me, that these are the people you have to give. This is the checklist. You have to check for these documents.
Okay.
And then, so first part of my conversation with him went like this, that you do not, we need proper checklist. I was being that first year student, that I am under orders and I need the paperwork, and your mother and your wife has the paperwork. So it's fine for them, but you don't have the paperwork. So just wait for it. In another 2 months, it'll be your turn. But then, this being India, and in the rural setup, you have a lot of private practice where it's very easy to get a medical certificate saying that I am hypertensive.
Okay.
And the man was very frank about it, that he said, if it's just a matter of medical certificate, then it's not a problem. I'll come back tomorrow with it. Now, I was at that point, again, the same thing, that, okay, this approach is not going to work. Now I can no longer use paperwork as a thing, and I have to have a proper conversation with him, where I have to explain to him why he should not be doing that. So I had a good conversation with him. I did not have much time because there were quite
Many
other people
patients,
in
yeah.
the view. Yes. So I just briefly told him that, like his mother and his wife, in the entire neighborhood, there might be many people who actually genuinely need the vaccine more than him. And yes, he can easily get the paperwork, but if he just waits for a little more time, he'll get it. And rather than getting his paperwork, he can just call over his relatives who are further inside the village, his friends. He can help in convincing them. And as soon as we finish the phase 1, we'll go over to phase 2. So at that moment, it looked like he understood my words, but I do not know the ending of the story. Maybe he went to another center and got the vaccination like he
You had
wanted.
that conversation with him.
I did, ma'am. And
Yeah,
he did
so
agree
that is
with me.
important.
He said
See,
he'll do it.
Yeah, you have to do that bit of it. What happens at the end, whether they go to another PHC or whatever to get their injection, is a different thing. But you did have the conversation. You did explain to them. You did tell them the rules and regulations and why he was not eligible, right?
Yes,
I think
and
you've
at that
done
moment, he actually kind of agreed to convince his neighbors and make sure that everybody in the group gets
So let's
it.
take it that you've been successful, Dr. Hema.
Yes, ma'am.
Yeah, so you've actually, without even knowing about the slice model, you have actually gone through everything.
Yes.
Yeah.
Yes,
so
it was a trial and error sort of method, which was very quickly.
Yeah. So if you keep these 5 domains in mind, it's very easy for you to, because many times we think we want to do good, but we forget the legal part of it. And it is the legal part that gets us into trouble. If we don't know the rules and regulations regarding our practice, then that is what actually, hinders us from doing something, doing our work properly. So that is why legal and the medical, what does the medical council say, what, all that is important for us to know. So actually you don't require the slice model. It's already ingrained in you, Dr. Sinema. Okay. All right. So thank you very much. Very interesting. Anyone else? Anyone else would like to share any case? Anyone can take a, I don't know, I can see some, Dr. Aditya, you're part of the team, or are you a participant?
Hello, good morning, ma'am.
Morning.
No, I am a participant.
You're a participant. So would
And
you
I
like
am
to?
also a postgraduate student.
Yeah, in?
I am also a postgraduate student in the Department of Community Medicine.
Okay. All right. So we would you like to share any ethical dilemma that you have?
I do not have many encounters, many incidents where I was faced or I faced an ethical dilemma, but I can remember one such incident. It was not any major incident. If I think, but okay, let me just narrate it to you,
Okay.
if it's all right.
Yeah, no problem.
This incident happened during my posting at the Rural Health Training Center. This middle-aged lady had come to me, had reported to me. She asked me to make her mother make a medical certificate for her medical fitness certificate for her mother.
Okay.
And she just explained me. She just explained me the situation. Why does she need it? Maybe it was a long time ago. I guess 10 to 11 months ago, in the beginning of this year, I suppose. So she told me that she needs a medical fitness certificate for her mother, for them to be able to travel to a different place. She told me like that. But dilemma was the situation was that she hadn't brought her mother with her.
Okay.
So okay, at that time I was also unaware of this life model. But what I believe I did was right. I refused to give her mother a medical fitness certificate because she hadn't come with her. What I thought was, without examining, without seeing and examining the patient, how can I issue issue her a medical fitness certificate?
Yeah, that's
So
true.
I just
Refused.
I refused. Yeah, and she immediately left the center.
Okay.
Maybe she might have got at some other place. So
yeah, but okay. So this is a very common situation, Doctor. It happens to majority of the doctors. In fact, your relations or relatives also come and ask you to give a medical certificate. But so your conscience told you this was not correct, actually, right? So because you cannot give a medical certificate to a person who you've not examined or and not even seen, right? So this is what is important. So then the laws of the land, what does it say? It says you have to examine the patient and you have to, then only you can certify. That is a fact, right? Now the problem here is today we give a medical certificate and then something happens. That is where the legality and issues come in. So suppose you give a certificate certifying that this patient was all healthy and good and whatever, and then especially if they're going abroad, and you said this patient, they wanted to go abroad, right? Was it?
They didn't want to go abroad, but they wanted the certificate for them to travel as a pass for traveling. That's what they said.
Okay, okay, maybe, but think about it. Even in the international thing, you give a certificate, and majority, when they travel abroad and they fall sick, and suddenly, when the doctors there examine and find a lot of stuff, then you are actually in trouble. Okay, so the legal issue starts there. Okay, but you probably would have it would have been, you probably would have told that lady that, it is not possible to give a certificate, and you probably would have explained, right, why it was not possible, right? To give a certificate, you had done.
I told her I did my part.
Yeah. So
But
you have.
still, after doing that, she was not convinced. She was still not convinced, and continuously, repeatedly requested me, please
Yeah.
give me a
So
certificate. I need it.
Yeah. At some point, you
Yeah.
have to say it is not possible, and without examining. So please bring the patient. I'll happily give you a certificate once I've examined the patient. So you've done your part, and you've gone through all the conversation, and at the end of it, probably, you probably. She like you said, she would have gone to a different doctor, but then you have gone through all those domains that we explained in the slice model, and that is what is important.
Domains. Yeah.
So that is good. So that is a common, So Dr. Aditya, thank you, because that is also, see, issues what we're talking about.
Yeah, thank you so much, ma'am. Thank you so much.
Is what we face daily. You are faced daily actually with the ethical, lots of ethical
Issues.
dilemmas. Yeah, thank you. Anyone else would like to share?
Thank you.
Would anyone like to share any other ethical dilemma? Anyone who is...
Hello.
Yeah, Harsh, is it?
Yes.
Harsh, we can't see you. Only we can see you gazing at the sunset or sunrise, but we cannot see your face.
Can I switch on my video in a while, because
please. Yeah,
I'm not in a proper place, right?
Okay, that's okay.
Okay.
So we just want your face. That's all.
Okay. So should I turn my video on?
Yeah, please. Okay, Harsh. Okay, go ahead. You have a dilemma.
Okay, so the dilemma which happened did not happen to me. It happened to someone else.
Okay.
So what happened was, it was during when the lockdown was being strictly enforced, during that time when the cases were rising rapidly.
Yeah.
So there was this patient who had lost his mother to COVID, and he was with her throughout the time. And then she died, and he was forced into quarantine.
Yeah.
And the mother passed away when he wasn't there with her.
Okay.
So due to the protocols, he wasn't even allowed to see her dead body.
Yeah.
And the person I was talking to was an intern, and she was forced to not allow him to go even to visit her dead body, because he was suspected to have COVID. He did not have COVID, he was suspected to have it. So for those reasons, he wasn't even allowed to leave that COVID.
Yeah.
And so she did wonder whether she should just allow. It was the night time, nobody was there. She was the only person in charge. So she
very
did wonder
easily she could have actually,
she could have, but she did not. And it was a difficult one. The patient cried, he begged, he tried everything. He just wanted to see her face.
This is Harsh, this is a common situation. It happened all over the world actually, and then a lot of rules changed. WHO also changed rules. There was a lot of cases against doctors regarding this, because many patients died in isolation without seeing their loved ones, and they were very angry. And some of them were also victims of physical assault because of that. Because remember, like I said, death in any way, whichever circumstances, is very difficult for anyone. And that is the time when we have to be most empathetic. And if you wanted to see ethical dilemmas to the maximum, it was during the COVID period. Any type of ethical dilemma you wanted to see was there during the COVID period. And this was a dilemma that came in and became a very big issue in USA and UK, saying that how can people die alone without seeing their loved ones? And then slowly the rules changed. But unfortunately, we are bound by the laws of the land. Now, if the rule was that we are not allowed to do it, we cannot do more. It's not possible to do it. We can explain to the patient, but this is something I'm sure the intern, your friend, would have had that, it's like we call it moral residue. That is, did I do the right thing? Did I do the right thing at that time? I should have done something. I should have, like how you said, this is a moral residue that most of us will have when we deal with patients. It'll be there all our lives. Have we done the right thing? Have we said, the right words? I should have done it. Probably the situation would have changed. But remember, we are bound by the laws of the land. When you take ethics and legal issues always trumps over ethics. So tomorrow you won't be taken to court for being ethical, but you'll be taken to court for breaking the laws. Okay. So actually what she did was correct, but in the process, it is a moral, moral dilemma that she had to go through. She followed the rules correctly. That is true. But you wanted to say, yes, Harsh?
What my take is that these issues, these situations, they don't have a perfect black and white answer. There's no correct way to handle that. I mean, you just have to follow the rules. There is a lot of ambiguity. And personally, I don't think I would have adhered to the rules.
That is for everything during the pandemic, because it's the first time we are all facing a pandemic. So there was no rules and regulations, right? There's no real, this is after 100 years, we're seeing one pandemic like this. So now that this was actually an opportunity for the medical fraternity to change rules, make rules. And now if you know that now you know that, if there's a pandemic, these are the things you have to follow. But the initial portion was very, very difficult. Okay, I think I have exceeded my time. I think the next webinar is going to start. So I just, Harsh, thank you so much for the case.
I just have one question.
Yeah.
I get this word a lot, that you shouldn't be sympathetic with the patient, but rather should be empathetic. Could you give me an example?
So the difference between sympathy is like, you're sorry for the patient. But when you use the word empathy, it is you are putting yourself in the patient's shoes. You can feel sorry, that is okay, but you don't have to feel like the patient. Empathy means, suppose I were in the same situation. How would I feel? You understand?
Okay.
Okay. Right?
So that is the answer which I've gotten so far. Like almost everybody. I want clarity. Like I mean,
clarity is, I can say, Harsh, I'm very sorry for you, or to your friend, to your friend who had this issue of not allowed. I say, I'm very sorry that you had to go through it, but I may not feel for her, no? I may not feel, but if I were in her position, I'll think about it, and suppose I were in my position, what I would have done. That is empathy.
So you could be empathetic and sympathetic at the same time, right?
You can be empathetic and sympathetic, but you can, if you're just sympathetic, doesn't mean you're empathetic.
Yes, I understand.
Okay.
Thank you.
All right. Thank you very much. Thank you for to all who made the session interesting. I know some of you are still, you have joined. I think the next session is starting. So thank you very much. Thank you to the organizers, and thank you to Aman for sharing this. Yeah. Thank you very much.
Thank you, ma'am. Thank you.
Thank you.
Thank you, ma'am, for joining and really taking out time from your busy schedule and really making the SLICE model very easy for all of us to understand. And also a very big thanks to our delegates who joined. And I hope that this workshop was a wonderful learning experience for you all. So I hand over to Mamta, who is our moderator for the next session. And we'll be having Dr. Derek Sir's workshop next. So, Mamta, are you here?
Yes, ma'am, I'm here.
Yeah.
Very warm greetings to everyone assembled here. Okay, I think we can wait for a while.
Oh, excuse me. When did this session start?
It just started. I mean, it's just gonna start.
No, the previous one with Dr. Mary.
Just a minute.
That was at 8
8 a.m. Yeah. Mamta, someone will be handling the breakout rooms.
Yes, sir. I'm just 1 minute, sir.
Just
Yes.
Shiv, just wanted to check up about Dr. Shabir's
Yes, sir.
workshop. Is this tomorrow?
So the workshops are all scheduled for today only. I think it is in the evening slot.
Yeah. Just see that somebody messages him.
Okay, sir.
Very clearly, because I just got a message from him a few hours back. It may be late night for him now, but
Okay, sir.
just see that a comprehensive message stating that it is Ethos, stating how many participants are there, so that
Okay,
you know,
sir.
he needs a little bit of mental preparation at least.
Mhm.
And if a copy of that message can be sent to me, then I can also reply back to him, you know, so that we don't give two separate
All right, sir. All
messages.
right. Yes,
Okay.
sir. Sure, sir. Sure, sir. I'll send it to you also. Yeah.
Are these sessions paid? Are the workshops paid?
No, sir. We've asked everyone to attend.
Okay, great. No, someone asked if we haven't registered, do we get?
Initially we started.
No,
with the
not from
paid
that
thing,
point of view.
but
Somebody put in the chat box, if we haven't registered, do we get the certificate? So I
no,
said
they
before
can attend, sir. They can attend.
No, they want a certificate. Sorry.
Mamta, why are we waiting?
So I'm
I
just
think,
waiting for the participants to exit and join.
But it's fine. I think many of them would have joined from
Okay, okay, sir.
session
I'll
itself.
just.
So yeah. I think you should go ahead.
Okay, sir. A very warm greetings to everybody assembled here. I am Mamta Jadhav and I take the privilege to moderate the session today. Communication skills is something that doctors really need to master, not just communicating with patients, but also with peers and juniors and seniors. Our esteemed guest, Dr. Derek D'Souza, who is head of the training program, International Chair in Bioethics, which is formerly known as UNESCO Chair in Bioethics, Haifa, will provide us the solutions necessary to learn and develop your communication skills as educational and institutional tool. Thank you, sir, for joining us today. And I request you all to check your connection as we're going to start the session.
Mamta, do you have the email IDs or the phone numbers of those who are registered?
Yes, I'll WhatsApp it to you.
No, just send a reminder if possible, saying session is started or starting, so that they can join.
Okay, sir.
Because you told me there were about 45, right?
Yes, sir. They were registered.
Yeah, so whatever, that's not a problem. But if you can just
Yes, I'll
send a
remind them.
reminder out to them.
So actually, we have emailed them in the morning
Okay.
itself. So I think we are good to start.
Okay, fine.
Yes.
So shall I go ahead?
Yes, sir.
Okay, thank you.
You're welcome, sir.
Right, I hope my slides are visible. Just a minute. Yeah. Okay, I hope the slides are visible. Can somebody kindly confirm?
Yes, sir, they're visible.
Okay. So thank you, Mamta. Thank you, Dr. Shiv, and everyone else from the organizing committee. It's wonderful after a long gap to be with you all at Ethos 2021. There were a lot of doubts and a lot of questions due to the current situation, whether we would be able to pull this off. But I think the entire organizing team has done a wonderful job. And it is purely because of their efforts that we are being able to work this out today and give me this opportunity to be able to interact with you all, and a very warm welcome to this session. We are going to talk a little bit more than just what you normally would expect at a workshop on communication, but we're also going to look at some personal growth and self-development. Because if I don't improve myself, if I don't feel good about myself, then how do I make others feel good? How do I get others to get better? I'd like this session to be interactive, so you may please unmute yourself at any time and interrupt, ask your question, get your doubt cleared. And when I do ask you for inputs, I'd love to hear from all of you, because that's the whole idea of having a workshop and not just a one-sided lecture. Yes. So this friend of mine who sent this photograph to me, would somebody like to identify his profession, or what does he do, or what do you think this young man?
Instagram में direct message करो.
Yes, would someone like to tell me? What do you think his profession is? Anyone, please.
This one looks like a beggar.
No, I'm sorry. I shouldn't have gone ahead.
On the first
I'm sorry. Yes, please.
picture, sir, shows, I think he's a plumber. Cleaning.
He's
Plumber.
either gardener or a miner.
Gardener. Okay, somebody recognized his tool. Okay, he's a gardener. Yes, anybody else?
So he could also be a miner. No, not a miner.
All right, fair enough. Given. Yes.
He could work at a burial site.
Burial site. Okay, someone is having little pandemic hangovers. Okay, yes. Yeah, please. Can I request you to mute yourself after you finish speaking? I realize some of you all are in other environments. So, Uzma, can you please mute yourself if you finish speaking? Yes. Okay, let's go ahead. What about this guy?
Beggar.
Beggar. Yes. Anyone else?
A garbage driver, garbage man.
Garbage. Okay, fair enough. Yes. Anyone else? I think there are quite a few people on the webinar. I think we're more than 20. So I'd like to hear from more of you because this is important. Yes?
Homeless person.
Homeless person. Okay, very nice. Anybody else? Come on, I'd like to hear. This is supposed to be on communication. So if we don't communicate, then this workshop is bound to be a failure. Yes. I hope I'm audible to everyone.
Yes,
If
sir.
someone is having an issue, please let us know because then we won't go ahead. Yes, some more. I don't want to be this to be a class and me to call your name. So please let's all just definitely you'll are watching the screen and you can see what is there. So what is your first thought? Yes, somebody else? One more?
A beggar.
A beggar. Okay, fine. Thank you for those inputs. But again, I'd like to hear from a lot more of you. Like I said, it's a communication workshop. And if we don't communicate, then I might as well go home. So, okay, let's go ahead. So actually, my friend was just posing for a photograph, but Edgar Gonzalez happens to be the CEO of a Fortune 500 company. So nothing to catch you all off guard, but it is just something that we automatically would assume. And this other friend of mine, Jacob Williams, just came back from Iraq. And he is a decorated Army combat veteran. Again, it's nothing to do with anybody gave me a wrong answer, but it is what we assume when we meet someone for the first time. These are two, the same person actually. But which of these, if they were sitting in two different rooms, would you go to for a specialist consultation? And again, the same person, but if the one on the right were to meet you outside the OT and tell you that, okay, I'm the cardiothoracic surgeon and I'm going to be operating on your loved one, what would be your immediate reaction? So while we understand and we keep saying that we should not judge a book by the cover, what happens very often is that we do rely on first impressions, we do rely on looks, we do rely on what a person appears to be. And therefore, if you look good, you feel good, And if you feel good, only then can you do good. Now, don't take me wrong in saying that therefore I have to dress up, I have to truly wear a suit and tie every day in my OPD. No. But my basic outlook, the basic clothes that I wear, the fact that if I'm a guy, either even if I have a beard, it should be neatly trimmed. Otherwise, I should shave. I should wear a clean set of clothes, not wear ragged jeans, tattered jeans, and be in all types of unacceptable footwear. Because remember, the patient has not met you before. He's going to meet you, he's going to see you for the first time. And if you don't inspire confidence, if you don't inspire an atmosphere of trust, they are not going to be able to open up to you as a complete stranger and tell you what their problems are. And this is again hardcore research that no matter what job you have in life, just 5% is determined by your academic credentials, 15% by experience, and 80% by your communication skills. Again, we know talks of violence against doctors, talks of how people are misbehaving in healthcare institutions has become front page news in all parts of the world, not just in India. And the reason for that, very often, if you talk to them, it is because of failure in communication. It's very rare that actually they say the doctor gave a wrong treatment or the doctor gave a wrong medication, but it is a failure in being able to communicate between the healthcare provider and the patient or the family. So today, when we talk about ethical communication, that is effective communication, and that involves breaking down the various barriers to communication that we're going to look at ahead today. And again, please remember this, even if you are sitting quietly in your OPD, if you're sitting in one corner of your ward, or even if you're just walking in the corridors of your hospital or your healthcare institute, you are communicating a message. Everything you say or do, and more importantly, don't say and don't do, sends a message to others. So whether you are looking at your mobile phone, whether you are looking at someone else when the patient is speaking to you, the way that you walk into the ward, the manner, we've already spoken of the clothing and your overall outlook. So everything, remember, is communicating, is shouting out a message, even though you may be quiet or you may be actually talking to someone else. So therefore, I ask all of you now, and I'd like to hear from everyone in this workshop, what is communication? What do you mean by communication? Yes. Just what comes to your mind when you hear communication or somebody asks you, what is communication? I don't want a textbook answer, but just what is there in your mind, what comes to your mind immediately? Yes, anyone?
So to me, communication is getting my point across, something that is in my mind and I want the
Getting
other
your
person
point
to
across.
know it.
Very good. May I know your name, please?
So I'm Dr. Himabindu, first year postgraduate student in community medicine, Vardha.
Thank you. Thank you for that, Himabindu. Very well said. Yes, someone else? I think everyone is taking the fact that I said you don't have to talk as a means of communication. So either there's a hidden message for me in the fact that you all are silent. Yes?
Good morning, sir.
Yes, Aditya,
Yes,
please.
yeah. I would not, I'm not saying or I'm not narrating a very different answer, a similar
Yes.
answer, but what I believe communication is expressing one's views to a person in such a way that the person finds it sound and right.
Okay. Okay. Very nice.
That's
Very
what I
nice.
believe what communication is.
Okay.
Justified.
Okay. Thank you. Thank you for that. Yes. Anyone else?
Yes, sir.
Yeah,
So
please.
to me, communication is effective exchange of thoughts and ideas between two parties or individuals.
Yes, two parties, exactly. Very well said. I think I saw something in the chat. Yes, someone else? I don't know if people have just logged in because I don't hear anyone. Yes. Thank you, Shiv, for that. This is supposed to be interactive, and anyone who's logged in here from wherever you are, I told you it doesn't matter. We are not keeping score, or there are no right or wrong answers, but I need to hear from you. Otherwise, I might as well just share the PowerPoint and we all go on with our daily routine. Yes, what does it mean to you when you hear the word communication?
Hi, sir. For me,
Yes,
the definition is like the same, that whatever there is in my thoughts, I
yes,
across, and the other person can understand what are in my thoughts or mind.
yes, yes. Thank you for that, Rajni. Important that you said the other person must understand. Yeah, please, we'll take that up. Yes. We're going to wait to hear from everyone. I have the whole day for you, so.
Good morning, sir.
Yes, Sunidhi, thank you.
Yeah.
Please go ahead.
I believe communication is exchange of information via a certain medium, which can be speaking or writing, or it may be telephonic or
Okay.
different mediums. Yeah, to make the other person understand what we
To
have in our
make the other person understand what you have in your mind. Very good.
Yeah.
Yes. Anyone else?
Hello.
Yes.
So,
Please go ahead.
sir, in my opinion, communication is an art of expressing or sharing your ideas in an understandable way, so that the other person can perceive.
Yeah, yeah. Okay, very good. Very good. Thank you for that. Please don't Google. I told you this is not a workshop on finding information online. I want to hear your actual thoughts. All of you are absolutely right. But I'd like to hear what is there in your heart. We are communicating, remember. So, what is there in your mind? What is there in your heart? We want to understand that. Yes? We're not going to communicate very much in silence. Maybe some of you are upset with me for some reason and therefore sitting in silence. If that is your message, you can type it in the chat box and tell me, sir, I am upset with you and therefore not communicating. But otherwise, we don't progress in a workshop on communication.
So
Yes?
I would also like to add one more point, which just
Yeah.
came to mind. It is also the effort that we put so that we can express our ideas. Like everyone, says something, but it is more about the effort that you put in so that the
Okay.
other person can get your point. It also about the effort that you put
Effort.
in.
Yes. Thank you. Thank you for that. I'll come back to that. Yes. A good important point that you made. Yes. See, we learn from each other. That's why we have kept these as interactive sessions. Yes.
So also it is important that we communicate in a better way
Yes.
because it solves our fights and it builds trust and has better relationships with each other.
Beautifully said, Mamta. Beautifully
It
said.
basically increases our engagement with each other.
Exactly. Exactly. That's the solution to most of our problems. And if you remember what I said in the previous slide, it is your guarantee to success. So it doesn't matter what profession you are in, whatever job you do, or even if you're just going to be at home with friends, with family, in the workplace. If you communicate well, you're going to be a success at whatever you do. Yes, wonderful ideas coming out. A little bit delayed, I don't mind, but I want to hear from everyone, please. I just want to actually check how many of you are listening. So I ask you a very simple question. Would you like to continue with this workshop, yes or no? So could all the participants just unmute yourself and tell me, or put it in the chat box? Because I wonder
Yes,
if there
sir.
are people who are just logged in from the previous session and haven't logged out. And I just want to know how many are actually hearing me right now.
Yes,
So I
sir.
have just 2 hands.
Yes, sir, we would like to continue.
Yes, sir. We want the session to be continued.
But I want to hear from each of y'all, and it's not happening. 5. Eight. Okay. Anybody else who is hearing us? Yes, so Shweta and Kashifa and Tabitha, all of you can hear me, right? So I would like to hear from you all as well. Okay, so let's move on. And I hope that this becomes a little more interactive. I don't know why you all are hesitant. I told you, if you have any problems with your audio, you can type it in the chat box. If you don't wish to switch on your video, that too is fine. I understand each one of us have problems, but we have to communicate in some way or the other. All right. So if we are going to look at a little bit of a formal understanding of communication, it is the transfer of information. So we are trying to get a message across. And I think this all of you brought out. From a sender to the receiver. So there has to be a potential receiver in mind whenever you are planning a communication. Whenever you are planning, whenever you are sending out a message, you need to have someone in mind. It may not be that the person is available right away, but there has to be someone there. And what is most important is that the information has to be understood by the receiver. I think all of you are familiar with WhatsApp, 1 tick, 2 ticks, blue ticks, and that is exactly how they want to confirm the communication. Yes, Mamta, please go ahead. You had a question or you were just responding to?
No, sir, I was just responding.
Okay, fair enough. But like I said, you can just unmute yourself and talk, please. I don't mind. In fact, that's better. Okay, thank you, everyone. So until
this definition came to existence in 1988, right?
Yes.
So we don't have a better definition for communication so
No,
far.
I'm Harsh, don't get me wrong. I've just given credit to the people from whom I took this definition. In no way am I saying that this is the best or the only one. The reason I like it is that it possibly gives us the important aspects of communication. In the sense, transfer of information, very important component, a sender, a receiver, and most important part of the information has to be understood by the receiver. If it is not understood, there is a failure in communication and there is no communication. So please remember this. Yes.
How we ascertain that the receiver has understood our message?
Exactly. That is what we need to concentrate on. And that is what we're going to take up throughout this workshop. So just hold on to that thought for some time. And if it is not covered or you still have a doubt at the end, then I will come back to it. Okay. But important point that you raised, if I am the sender of the information, if I am going to communicate or I wish to communicate, until it is understood, the process does not end. So in simple terms, not just saying, have you heard, have you understood? Everyone shakes their head. You have to ask counter questions. You have to ask maybe a question or two regarding what information you have given to ensure that the matter has been understood. I think all of us have been students, or if not, we've taken some classes somewhere or the other. And when you ask students, or when you are asked as students by the teacher, have you understood? Everyone nods their head and everyone puts up their hand and says, yes, we understood. But God forbid if that teacher says, okay, I'm now going to take a pop quiz, I'm now going to ask a couple of questions, then very magically everybody disappears from the class and we don't find anyone there who is willing to stand up and say, yes, I will answer your question. So whether it is understood or not has to be kept in mind, especially in a healthcare setting. Okay? All right. So when we talk about communication, it is an entire process. It is not just one-way communication. And again, this is from the research. Please look at the quantum of listening. We keep talking and talking and talking, or reading or writing, speaking like I'm doing now. But what is more important, or what is most important, is listening. So even for us as healthcare professionals, it is important to develop our listening skills more than our speaking skills. Some way or the other, we do speak, we learn the language, we learn the terminology, we learn the technicalities, so we can speak, but we forget to listen. So when we talk about communication, just for, again, this is more theoretical, you have verbal and non-verbal. So I don't think this needs to be explained further, but this is more important. Like you saw the pictures that I showed you, and we'll go through a few more examples. The receipt of the communication or the receipt of the message is 2/3 from the non-verbal part. So it's not just what you've written, or it's not just the style of your speech, which all comes under verbal. but the non-verbal part. So when I say verbal, remember, it is both spoken as well as written. So if you are communicating with someone important, the way that you would communicate, would you send it as a formal letter? Would you send it via email? Would you take the trouble of going and giving it by hand if that person is close by? And of course, the language that you use. But the non-verbal part, the letterhead that you use, the layout, are there any spelling mistakes? How good is your preparation? How are you standing when you deliver the message? All that is more than 50%. In fact, 2/3 of the message comes from your non-verbal part. So please keep this in mind. So therefore, I ask you, and again, I'd like to hear from everyone who's here, is communication easy? Or do you think communication is easy?
So it depends on the person who's sending the information and person who's receiving the information.
Very good. Yes. Someone else?
Sir, I think if we consider the aspect of the other person having understood us,
Yes.
then communication is definitely never easy.
Okay, thank you for that. And thank you. That's why you're all here today. Yes, anyone else?
The communication is
Sir,
more
as
likely
you mentioned before.
Yeah, one at a time, please. Just raise your hand so that the other person also knows that you're going to speak. Who was it? Was it Harsh?
Okay, sir. I'll go.
Sir, I was speaking.
Okay, Harsh first, and I
Okay,
don't see.
sure.
Can you identify yourself, please?
Sir, I think Harsh and Aditya, there are two participants who want to speak.
Okay, so we'll go with
I'll take the
Aditya.
order.
We'll go with
Yeah.
Aditya. Yeah. Aditya,
Yes, sir.
please go ahead.
Yeah. Sir, as you mentioned before, depends on this situation
Yes.
and the sender and the receiver themselves.
Definitely. Thank you. And thank you for bringing in the context of situation. That is again important. Yes. Harsh, please.
So communication is most likely to be easier and faster among individuals who have known each other for years. So they could send a message across in fewest amount of words.
Okay. But I don't have that opportunity always, do I? I can't expect to have only my near and dear ones or my friends to remember. We have this background of understanding we are in healthcare. And a lot of our communication or the importance of communication is in the professional field. So you are absolutely right that old friends communicate without saying a word. When you are with your loved one or someone who really understands you well, your mother, father, whoever it is, you don't really need to speak too much to them, but yet they understand. A mother understands every wish of her newborn baby by just looking at it. They don't wait for that child to really say a word. It's just a look that can communicate. You're right, but thank you for that. Rajni, please.
And so speaking in the patient's language, in the case of a doctor, when we are able to speak in the
Very
patient's
true.
mother tongue, it becomes
Very
much
true.
easier.
Very true. Very true. Rajni had your hand raised first and then Mamta.
Yeah, sir. I feel it depends upon the situation where we
Yes.
are communicating. And also depends upon, as it's already said, is the receiver. And I don't think communication is so easy. Effective communication is so easy. That's why I'm here attending the workshop.
Thank you for that. All of us are, including me. Okay. I may be presenting, but I'm also trying to learn from each one of you. Mamta?
Yes, sir. I feel that the means of communication is like the one which matters the most. Like an in-person communication is always better than the one on virtual.
But if I don't have a choice, what do I do? Now, I can't meet all of you in an offline session, which I would have loved to do this. So then what do I do? So you're right. We have to understand the situation and tailor make our communication so that it will reach the receiver. Now, a lot of things in this workshop, there were a whole lot of activities that I would have done if we were offline, but I had to change the complete presentation. I had to change everything that I normally would do in this workshop to suit the online or a digital mode. So similarly, a small example that if you have a noisy OPD, you need, and there is an important message, or maybe you are working with senior citizens. So it is expected that their level of hearing is going to be different. So either you have some sort of barriers for the sound, maybe you can close the door, maybe you can take the patient to an area where it's pretty quiet and then communicate to them, especially if it is bad news, if it is something that you would like to keep in privacy. So absolutely right. And I'm glad all of you are bringing this entire concept of the situation. So like we said, our conversations, our communications have to be tailor-made according to the receiver and according to the situation. And thank you, Kashifa, well said. According to the healthcare sector, it depends on the individual communicating with along the same wavelength. So I like that concept of wavelength, and we're going to build on that as we go ahead. So yes, some of you have said it's easy, but we need to tailor make. So let's watch these two videos back to back, and then we'll revisit this idea. So once it starts playing, again, if one or two of you could just let me know if the sound is audible, because this is important.
Yes, sir.
I hope you can hear the sound from the video.
It is audible, sir.
Okay, thank you so much.
Please say hello to start.
Hello.
I didn't understand your response.
Allô.
Please say hello to start.
Hello.
I'm sorry, sir. I can't understand you. Could you please repeat your response?
Hello.
I'm still waiting for your response. Please say hello to start.
Hello. Allô. Hello. Hola.
Calling iRabbit International Help Desk for assistance.
Hello, sir. Thank you for purchasing the iRabbit, your own personal digital animal. Raj at your service, sir. Before I can help you out, could you please spell your name for me, sir?
T. H. I. E.
Is that an O, sir?
Yes. E. R. One more R. Y.
That is not a letter, sir.
It's the letter Y.
Can I just call you Greg, sir?
I'm Thierry. Thierry.
Bien sûr, monsieur. How can I help you today, Mr. Greg?
I tried to start my iRabbit, it doesn't work. I'm very tired and hungry.
Sir, if you're hungry, I can call you back after lunch.
No, wait! I shake the rabbit, it doesn't function.
Sir, please do not shake your iRabbit. Press the tail to start.
I tried, it never works. I hate the rabbit.
Sir, your 1-year limited guarantee doesn't cover chewing or biting the device.
No, I hate the rabbit.
Heating can cause fire in your house, sir.
No, I eat the rabbit.
I understand that you are a non-vegetarian, Mr. Greg, but I would personally advise you to not eat the equipment, sir.
Can I talk to your chef, please?
I'm calling from iRabbit International Help Desk. It's not a restaurant, sir.
The restaurant. I would like to talk to your chief.
We are based in a developed country here. We don't have any chiefs or tribes now.
But I paid a lot of money. It is not cheap.
Exactly, sir. It's a rabbit, not a sheep.
I mean, it is not cheap.
It's a rabbit, not a ship.
It's not cheap.
It does have an electronic chip inside.
Please, focus on my problem.
I don't quite understand you, sir.
Please focus.
I beg your pardon?
Please focus on the rabbit.
I'm sorry, sir. I can't accept that kind of language. Thank you for purchasing the iRabbit, your personal digital animal.
Hello.
Welcome, Greg.
The name is Thierry.
Nice to meet you, Thierry. What can I do for you, Thierry?
Okay. Can I get some comments before we move ahead? Just what went through your mind?
Patience is one of the key to communicate.
Patience, okay, yes. I think both were trying to speak English, am I right? That much was
Yes, sir.
obvious. So,
Some
you know, at
differences in-
times we talk about linguistic problems. Yes?
Hi, sir. Accent was different.
Accent, yes.
So then he was not able to put across
Right,
what he wanted to talk.
right. Okay, fine. Let's hear from a few more people. Yes.
I feel it was a very comic situation because both of them were understanding that they are not able to get their point across, but
Yes.
still they were not able to do anything about it. They were
Both
just
were
continuing
able.
with that.
Thank you. Thank you for saying that. Both were unable. They were talking and talking, but yet unable to communicate. Aditya.
Sir, yeah, I was about to say the same thing. Both were communicating, but were unable to understand each other.
Each other. Very true. Very true. Yes. And just put this across to maybe our own situation at times. That both of us are talking in a language that both parties understand, but is the message actually going across or not? Yes? Anyone else?
So I would like to add on also it is if you're trying to understand the other person's expectations, like what they really want to hear
Yeah,
from.
yes.
So
True. So despite, of course, here there were a lot of questions from both sides. And in fact, they were trying to communicate and do their best, but they were unable to get to the root cause. And thank you, Kashifa, for saying that. Pronunciation was the barrier. So when we talk about language, like I said, both were talking in English, but the meaning that was coming across, maybe due to pronunciation, a lot of it due to cultural barriers, and all this comes into your non-verbal communication. Okay, so let's look at one more video and then we'll go ahead. I think most of all would be familiar with this, but let's look at it in a different light today.
तुम का टाइम वेस्ट कर रहे हो, मेरी सिकाई हो चुकी है।
Yes. Could I get some feedback on this video?
Sir,
Yeah.
which I saw, the impression what I am getting is that you don't need always a verbal way for communication. The body.
Excellent. Excellent. Thank you, Rajni, for saying that. Yeah, go ahead, please.
So that is the body language and the expressions you can effectively communicate in some situations.
Very good. Yes. Please go ahead, others as well.
So this clip was very contrasting to the earlier clip.
Yeah.
Both the parties understood each other even without a proper sign language, and we as viewers also understood what was happening very effectively.
Yes, thank you, Hima Bindu, for saying that. Very, very nicely put. Anyone else?
So this clip has overemphasized the fact, like you had stated before, that non-verbal means of communication had greater impact as compared to verbal communication.
Very nice, very nice. So could you highlight some of the non-verbal? What all was the non-verbal part in this clip? Anyone?
Yeah.
He took out.
No, you
can
said
continue.
expressions, gestures and expressions we had, and thank you for that, Kashifa, as well. So gestures we got was one. Expressions was another. Aditya?
Sir, I would say, okay, signs.
Signs, very
They
good. Yes.
he used his, yeah.
Exactly.
Communicating
through signs, through gestures. Yes. Okay, what else?
She showed her ring to emphasize that she was already
She
engaged.
showed her ring. Yes. So you can use this non-verbal cues to emphasize or to underline your point. Exactly. Yes. Anyone else? Let me give you a clue. There was a very loud something going on throughout. I don't know how many of you realized that. A lot of it was non-verbal, but there was one important communication that was also happening throughout the clip.
So the background music was light, so it made us understand that it's a fun thing that's going on and not anything serious.
Yes and no. And this is a lot of things we don't really give credit because it is so beautifully done, but yet it adds on to the communication. The fact of the music, and thank you for bringing that out, Bindu. The way you would have seen the music changed the rhythm changed, the every gesture was highlighted because of the musical score that was there. So that itself was communicating to us a lot of the feelings, the expressions, the every shot that was taken, you would have seen. And that is a beauty that we don't really appreciate always. Of a shot in a long shot, what they call a close up. So, what is the learning or what is the objective for us? That at times we may address someone in a group, we can address the whole family. At times we need to get close to the person and be one to one with them. Try and find out what they feel. Maybe, like you said, somebody comes to you with a pregnancy test, and the mother is there, the mother in law is there, the husband is there, in laws are there, and you find a whole lot of people, and the general feeling would be one of happiness. And so, on one, you are congratulating everyone, you're sharing in that joyous occasion. And then you need to come back to the patient and ask her, okay, what are your feelings? What are your concerns? Is there any question that you would like to ask me? And then it becomes more effective communication. So just keep these few thoughts in mind. So a lot of this was very beautifully put up, and I'm not going into each of them, but right from appearance, attitude, posture, expressions, eye contact, you saw how beautifully that was done, gestures and movement, body tension, the way they were interacting with each other, that little waiter and the little role that he did, it was over in microseconds, but it had such a lasting effect. Proximity of being close and being far away. And again, para language. Now, what is para language? That is when we heighten the tone of our voice or we lower the tone, the speed at which we speak, the volume of which we speak. So, normally, when we are communicating something intimate, something private, we talk in low tones and we talk slowly. If I'm trying to shout out a message to my class and get them to all quieten down, or maybe trying to make an announcement, then automatically my voice should be louder. I may be speaking much faster. So this is para language. Okay. So again, just a visual display to bring about everything together. So the distance you are with someone, touch itself. So remember when what you are speaking, if you're trying to comfort a patient, you can hold their hand. Again, of course, keep cultural sensitivities in mind, keep the age and the gender disparity in mind. So you can touch a patient just gently holding on to a hand or patting a hand or just touching someone. If you want to guide them to a place, you can just touch their elbow. These are normally considered to be culturally safe, or even if there is a gender disparity, they are slightly safer. But overall, your body language, your appearance, we went through it, eye contact, and of course, artifacts, everything around you would all communicate your message. Again, you can see just one girl and look at her expressions. We may not even know her, but we can easily guess her mood. And looking at her mood, maybe the way that we communicate will have to change. So start to look out for these, start to keep this in mind. It becomes very, very useful. And at times, it can be a warning to us as healthcare professionals of where we are in danger or where we are likely to face a situation that the communication is not effective. We've gone through this before, but just visual clues to tell you how your body language gives you a clue as to what that person is saying. So they may not talk, They may just be sitting quiet, but if you are learning to read their body language, you're learning to read their expressions, you're looking out for these clues, it will help you. So, whether someone is with their heads down, they're looking somewhere else, their hands are closed, they're sitting back, not leaning forward towards you, what is the impression that you get when they walk in? And most importantly, if a patient is lying, all this can be very easily picked up if you just keep these few things in mind. So, how can we maximize our skills? One is you need self confidence. It's not very difficult to learn. It's not where you have the confidence in your knowledge, you have your confidence in your subject. It's just that you need to believe in yourself. You must be willing to understand people. Don't look at people like the disease. And unfortunately, this is what happens as we grow in our specialities. We start to look at ears and noses and all of that, but we don't look at them as a human being with a medical problem. So change this definition in your mind. Stop looking at someone, oh, this is a gallbladder. This is maybe somebody with a ear infection. This is someone who needs a denture. Whatever it is, we have to realize the person, start calling them by name, and identifying them as people. Enthusiasm has to come in naturally. If you are bored, if you are sitting in that OPD against your will, nothing that I tell you is going to improve your communication. So you must love your job. You must be there, involved in what you are doing, and that is important. Again, most important, we also would like people to look at us or prove that they are listening to us. So, similarly, when you are communicating with your patient or communicating with the relatives, make eye contact with them. Make sure that they feel they are important and they are involved in the communication. And above all, that you are interested in what they are saying. This is the challenge because normally you find that there are 2, 3 people crowding your clinic, crowding your OPD, each one coming with their own. It may be your nurse, it may be your assistant, it may be your senior, it may be your colleague, and all of them want to bombard you with information. But you have to prioritize, you have to listen to them one at a time. Otherwise, you may listen to a lot of messages, but nothing is going to be effective. You are not going to be able to help anyone at the end of the day. So, like I said, this tells you in very simple language of how you can comfort a patient. Use your gestures, use eye contact, use that little bit of touch, all to emphasize the message that you want, all to heighten the communication and ensure that whatever you are trying to do is very, very effective. So, what are the barriers that we face? Environment, very, very important. Now, today, for example, I'm lucky there's not a lot of noise in my background. Whereas if there was some carpentry work going on, or someone was having a party outside, or they were just talking very loudly, there would be a lot of background noise and failure in this communication. The temperature in the room, if it is very hot, if it is too cold, whatever it is, it's going to be a barrier. Again, what about the other person? Remember, 2 people from different cultures, from different status, from different educational backgrounds will understand things differently. So don't assume that that other person, just because they may be well dressed or just because they may be educated, will understand terminologies and what we call jargon. So, jargon is where you are using a lot of technical language, you're using a lot of short forms, you're using a lot of acronyms, which only doctors or healthcare workers will understand. So, we have to simplify our communication and make it understandable to anyone. Again, time. All of us use this. I don't have time. I've got a start time for this workshop. I've got an end time for this workshop. I have to run for my class. So all of this plays a role in making communication difficult. Like I told you at the beginning, more importantly, it is listening. We just don't listen. You've played those games of Chinese whisper or whatever it's called, where you whisper a word, or sometimes it could even be an action that you want someone to copy, and you'll find that it just doesn't work because listening is hard work. Listening needs competition because so many different, we are hearing there's a song playing somewhere, my friend is calling me out from there, the patient is talking here, my boss is on the other line, someone has sent me a WhatsApp video which I want to watch. So there is competition of differing messages from all the time. Nobody has the time, nobody has the patience, nobody wants to wait, including ourselves, and this is the biggest problem. Again, a lot of people speak with different words per minute. So some people speak very slow, especially those who are aged, or if someone is learning a language for the first time, they speak slowly. For someone who's young or someone who's familiar with the language, may speak much quicker. And again, it's not just that if someone is speaking slow, they will communicate better. We will get bored. We don't want to listen because we'll say, chalo, chalo, jaldi karo, speak faster, go ahead with your story. Why you're telling me a whole background? So again, both too slow and too fast, both are something that is not required. And more importantly, is lack of training. Nobody has really taught us to listen or told us how important it is. We generally know it as a background, but we don't make a conscious effort. And I hope that if nothing else you take home from this webinar, we can take this matter of learning to listen. So how can we improve our listening skills? Not being preoccupied. Listen to one message at a time. Listen to one person at a time. Read that WhatsApp message if you have to. Watch that video if you have to. But once you have got the message, only then move on to the next. Be open-minded. Don't be defensive about everything. Listen to what the other person is saying. There is a message in what they are trying to tell you. Minimize interruptions. Again, because this is going to occupy your mind, pull it in different directions, and you won't be able to communicate. So effective listening is when you hear it, you interpret it correctly, most importantly, understand, and finally by asking questions. So the same happens with your patient. You have to ensure that they can hear you very clearly, they can interpret and understand what you are saying, and of course, by asking the questions. So important for you as a communicator, important to take the feedback from the person you are communicating with, from your students, from your patients, from your family members, and then you are sure that the communication is good. So we've understood body language, but just like a reminder of what body language is all about. So postures, gestures, the way that you stand, eye contact, very, very important. I cannot emphasize it more. And this is where we as doctors go wrong. I appear to be listening to my patient, but I'm watching someone else, or I'm looking at my nurse and telling her how to get ready for the next patient or for the next OT or whatever it could be. Orientation. How are you positioned with your patient? So the way that your office setup is there, the way that you will move in the ward, where will you stand in relation to your patient is very important. How do you deliver your message? How do you greet the patient? How do you make them comfortable? How do you ask on other things that you have requested them for? Overall, we've seen the importance of looks, appearance. I'll not go into that again. And last but not the least, using your own expressions of emotion. So if you are laughing and then you're telling that, oh, I'm very sorry to hear that you're not feeling better, it gives out a mixed signal. It is not effective communication. So keep this in mind. A little bit about difficult communication, or rather breaking bad news. Now remember, no one wants to really hear bad news. Bad news becomes worse if it is not conveyed in an acceptable manner. So if you convey the news in a very harsh manner, it is not something that anybody would like. And these are instances which actually lead on to doctor violence, which infuriate the relatives, which make them break down and get violent in the hospital. Remember, patients only want certain amounts of information and the right amount of information. So you can't start by saying there was heavy rain and the generator broke down, therefore the electricity failed, and therefore there was a problem with the ventilator, and then the oxygen backup wasn't there, the oxygen valve didn't function, and therefore your patient has succumbed in the ICU. What is important you are trying to convey is that the patient succumbed to his or her disease in the ICU. So how are you going to convey that information? And what is important to understand is that it can also be a therapeutic dialogue. It can be the start to finding solutions. So it's not something very easy to tell someone that they have tested positive for cancer, or maybe the surgery was not as good as it has expected, or maybe when they come back for a checkup, instead of being controlled, the cancer has spread. But use it as a starting point to go ahead and ask them, okay, what can we do now? What can we proceed now? How can we make you feel more comfortable? So use it in the right spirit. So what do I mean when I say bad news? This could be any information which adversely and seriously affects the individual view of his or her future. Okay, so it's not just bad news and saying, okay, I'm going out for a week and I'll not be able to see you. But a patient who is really serious and in ICU, and you telling them that, okay, I'm not going to be here for a week, is bad news. And again, what is the expectation and level of understanding? Now, this was beautifully played out in that video of the iRabbit. Each one's expectations were very high. The one requesting for help and service had high expectations. I'm going to get a solution. The one who was trying to help was really trying to help. But what happened at the end? Because both were unable to find that connect, nothing really worked out. So in a healthcare setting, what are some of the things where we have to be careful about? So a new diagnosis of a potentially life-threatening disease. How do you tell someone that you are COVID positive? Or a patient condition suddenly changes or is rapidly declining. You've tried some curative treatment and it is not effective, or you cannot give it because of some other complications. Where the test results are not what you thought it would be, there is a limited or poor prognosis. And last but not the least, you want to move the patient just towards palliative care, towards maybe staying in a hospice, maybe staying in a home where they can get palliative treatment and not really in a hospital. So just some of the ways or some of the means that bad news has to be delivered to the patient or the patient relatives. So very important when you are delivering bad news, the attitude and the manner. The clarity, how clear are you in telling the message across? Are you having privacy? Because one is we saw the barriers of noise, of environment. But if you are giving bad news and you want to give the patient privacy to break down, to cry, to even express anger, so you don't want to do it in your OPD, you don't want to do it in a busy ward. So identify places or identify times where you can give the message in the right manner. And more importantly, remember, as soon as someone has received the news, they will have questions. They will have, if you just tell someone your patient is no more, they are immediately going to ask you what happened, when did it happen, how did it happen, till yesterday he was fine. So there are going to be questions which need to be answered and they need to be addressed in the right manner. So what are the barriers? And once we understand these barriers, remember that we can find solutions. So lack of training or inexperience, young doctors, young interns find it a problem. But hopefully, the more we expose them to workshops like today, it becomes easier and better for them. There is a sense of anxiety. Naturally, who wants to be the bearer of bad news? There is a responsibility that we have as doctors, but at the same time, we feel inadequate because we have not been trained. You're trained in surgery, you're trained in pathology, but to convey that news, to convey the way of the message, that is important. And that is where we feel inadequate. So, this is why training in bioethics, training in biomedical ethics becomes so important. Again, when you go back on your word, you've promised someone, don't worry, your son is going to be better, your father is going to recover very fast. Yes, we are hoping that he or she will recover from COVID. And then you have to tell them that he or she is deteriorating. Today, the fear of a negative response and the emotional reaction. So people don't want to take that responsibility and therefore you delegate it. You give it to a junior, you give it to a nurse, and that is the worst thing that you could do. Again, there is uncertainty about your patient and the family expectations. How are they going to take the news? What are they going to do to me? And fear of destroying the patient's sense of hope. Remember, every human being is holding on to life, holding on to the fact that they want to live. And that becomes a challenge. You do not want to destroy that sense of hope. So when you are delivering the bad news itself, important to understand and have the follow-up concepts of being able to give them some comfort. So you all would have felt that, okay, Derek has given us a huge list of things to do, but what do we actually do? And for that, we have the SPIKES protocol. So just remember SPIKES. And if we follow this guideline or if we follow this template, let me tell you, it becomes very simple to break the bad news and to ensure a positive outcome. So we start with S, which is setting up or the setup, the interview. Remember, it's an interview, it's a dialogue, it's a discussion. It's not just giving the news and saying, okay, thank you very much. Please, you all can go and sit in the waiting room and you cry about it. No, it doesn't work like that. Assess the patient's perception. So, for example, if you are going to tell them about your test report that has come, either say positive for HIV or it's positive for a type of cancer. So you ask them, okay, when did you give your test result? What do you think? How are you feeling? So you get a little background. Are they worried? Are they concerned? Do they feel it is something serious? Then always obtain the patient's invitation. Means ask them, do you want me to give you the information now? Do you want to call someone else? Do you want to have other members of your family here? So, in other words, by not directly breaking the bad news, you will give the patient a sense that, okay, this is something serious. Maybe the news is not all that good. And it's mentally preparing him or her to get the news before you actually say it. So it's only at step 4 that we transmit our message, that we give the knowledge and information. So it's only here at the 4th step that we say, okay, your test results are back and this is it. Now it doesn't end there. Remember, there are 2 more important steps which we have to keep in mind. Step 5, manage the patient's emotions. Give them time, first of all. Let the message sink in. Everyone will be quiet for some time. Some may become violent, some may burst out with crying, but some may just sit quiet in shock. So understand that and give the proper response. Again, this is a good time to touch, to comfort, to pat someone on the back. Tell them you are not alone. And last, but what I would say is the most important, is to find answers together. Tell them, yes, your loved one is COVID positive, but you need not worry because today we have much more options. Today our COVID ward is relatively free. We have sufficient oxygen. We have ventilators. We have much better knowledge today. So we hope that your loved one is going to recover. So you build up a strategy. It becomes the starting point of finding answers together and working towards a brighter future. So this is some of the ways of breaking bad news, commonly called the spikes protocol. So I hope that that is clear. In case there are any questions, we'll just take a little bit of break from me talking to listening to all of you a little bit. So I'd like a little bit feedback from all of you at this point of time. Any thoughts, any ideas on some of these important concepts that we have discussed so far? Yes?
Sir, I think it is important to respect everything and every person we interact with for effective communication. We shouldn't just form a negative image of them or have any kind of prejudices.
Yes.
Because unless and until we don't respect a person, we won't pay absolute attention to what they are conveying.
Very true.
We should go at it with an open mind, like you said.
Very true. Very true. Thank you for that. Yes, anyone else?
So I think my takeaway would be that we should remember that even when we are not saying something, the patient is observing us, and our body language and our non-verbal cues are already telling them, giving them a bad premonition about what we are going to say. So we should be very mindful and we should be extra careful when we are with the patient.
Very true. Very true. Well said. Yes, anyone else? Yes, anybody else?
Sir, I would like to point out, like you had said, that we should be empathetic towards our patient and we should have sympathy for their attendees, the ones who accompany them.
Yes.
So that is something very important that we should always mind.
True. See, what happens is the more, even though experience does help us at times, experience can be a detriment, it can be a drawback, because this is happening to you on a daily basis. Now, at the height of the pandemic, the hospital that I was working at, we would lose almost 3 to 4 patients every day because we were, number one, out of the city. We were one of the tertiary care centers. We were slightly, what shall I say, didn't charge that much from the patients. So a lot of patients would actually be brought there literally gasping for breath, literally at the end of the situation. A lot of times they would literally be dumped in the OPD, in the emergency, and the family members would go away because they themselves were scared. And over a point of time, it's very difficult to remain shocked and to feel very bad. And yet, for the person who has lost his or her loved one, it is possibly the biggest tragedy that you can have. So, in order to protect ourselves, each one of us tends to build walls to start to isolate yourself from the situation. It's human response, it's human resilience that you don't sit down and cry with all your patients. Otherwise, our oncosurgeons and cardiothoracic surgeons would all be psychiatric cases. So please remember that these are some of the things that we can keep in mind, that these are some of the ways and means by which we can go ahead, by which we can understand each other better. So I know we're running short of time. Dr. Shiv, what is the plan? Because we started late. I do have a lot of things that can be taken, but I'd like to hear from each one of you because I realize others are also busy. How much of time do...
Yes, sir. Sir, you can take as much time as you want because the next session starts at 2 p.m.
Okay.
So we do have that buffer here.
Okay, okay. Yeah. I'd like to hear from each one of you because if you want, we can take on attitudes as well, or if you want, we can just summarize everything that we've spoken about and finish in about 10-15 minutes. So is anyone in a hurry or anyone have to leave? Please at least let me know that.
Sir, please continue.
Okay, anyone else?
Yes, sir, you should continue.
Okay, all right, good to hear that. Thank you so much. So I'll just, let me check where I am. Okay, so thank you. We'll move ahead and let's move on to our attitude and how we can be better professionals and therefore communicate in a more holistic manner. So I'm not going to ask you to this thing, but I just want you to write down what exactly professionalism mean to you when you hear this word or you count yourself as a healthcare professional. I'm sure each one of you has a piece of paper and pen, or maybe you can even type it on your phone. So I just want to know, what does professionalism mean to you? Just write down your thoughts, or as a definition or as a description. What would you say you are as a professional? Yes, when you are ready, you can unmute yourself and go ahead. Maybe just some words or a sentence, whatever is convenient to you. Yes, would someone like to share?
So may I say?
Please go ahead.
So to me, professional means if I'm on duty, being punctual,
Very
presentable,
good. Yes.
attentive to my job,
Yes.
and do my duty to the best of my ability. And in case I get any hurdles or problems, follow the protocol that has been advised to me while on duty.
Very nice, very comprehensive. Thank you for that, Himabindu. Yes, anyone else?
Keeping my personal biases and feelings foreign to the job I do. Shouldn't let them affect my opinions and actions.
Exactly. That means going beyond myself. I may have a bad day at home. I may have got some bad news personally, but I cannot allow that to affect my professional outlook, to affect my professional behavior. Very well said. Yes.
So I would even suggest an extreme example where, for example, if the patient I'm treating is religious and they refuse to take the treatment for those religious reasons, I
Yes.
shouldn't I should tell them about the risk and the repercussions of their actions, but I shouldn't force that treatment upon them.
Exactly. Perfectly said. Thank you for that, Harsh. Very good reminder of we should not allow our personal biases, our personal thoughts and feelings to affect the treatment protocols, to affect the advice. Personally, I may be for or against abortion. Personally, I may be having a family of XYZ, whatever, it doesn't matter. But if a young girl wants to come in and request for an abortion, the advice that I give her has to be absolutely professional. I cannot use this as an opportunity to question her morally, to make her feel bad about herself, even if I know the background. Even if I've communicated, even if I try and convince her what she's trying to do is right or wrong, goes without saying. I have to be professional. I have to be neutral in some way. And very important point brought out by Harsh that I cannot allow my personal beliefs and anything that is personal to me to impact my information to the patient. So, if we are going to define professionalism, it is not really easy to define it like we all know, but these are some of the characteristics that we must keep in mind. So, one is it's a vocation or a calling, and it implies service to others. A lot of times, remember, I'm talking more about healthcare professionals, so it would be with that little background in mind. Again, you have a knowledge base that has to be up to date. It is by virtue of being a professional, the patient expects that you have read the latest knowledge that is there. You cannot say that, no, I've been very busy in the OT, I was on duty this whole week, and therefore I didn't have time to check. They expect that you will take out time, that you will keep yourself up to date, especially in matters where things are changing very fast. Again, as a group, it determines its own standards. So, any professional organization has a standard. You have examinations that you have to clear. Then it has a special relationship. So, here we are serving our patients. We are here not to make money, not for our fame, not to have a big title, but rather to serve the patients, to ensure that they get better under our care. And of course, it needs certain ethical principles. So, if we are going to look at professionalism, there are numerous qualities that we need to have. If we don't have them, we have to develop them in order to call ourselves a true professional. So, if the American Board of Internal Medicine has come up with this definition, it says constituting those attitudes and behaviors that serve to maintain patient interest above physician self-interest. So I think this beautiful way of expressing that how the interest of the patients, what the patient needs, has to be above my own. I cannot look at what I feel, what I want, but rather what the patient needs. So these are some of the headings that are there. Let's look at each one of them one by one. So altruism means talking about the best interest of the patient, putting myself as secondary, putting the patient's needs ahead of me. Accountability means having a sense of responsibility, and accountability is different from responsibility in the sense that I can be taken to task. I cannot just say, oh, I'm responsible for this death. Oh, I'm responsible for the wrong medication. No. If something has gone wrong under my charge, under my watch, I can be held accountable. I can receive some punitive damages or some punishment. Only then it is called accountability. Otherwise, you just say, oh, I'm responsible. Okay, I'm sorry. I won't let it happen again. Accountability goes beyond that. Excellence in our conduct, excellence in everything that we do. So it means making an effort to exceed normal expectations. Okay, I'm expected to be in the OPD from 8 to 4. But I know that there's a pandemic. I know patients are coming all night. So if I can be there earlier and I can leave only when the last patient is taken care of, that is excellence. And of course, it entails lifelong learning. But without learning, without having knowledge, one cannot be a true professional. Again, duty, and look at that word. It is free acceptance of a commitment to service. Every word is so beautifully mentioned. It is not something that is thrust upon me. Even though you are expected to be on duty, you are accepting it as an individual. And only then will we feel happy in our work, will we feel committed in our work. So just keep these few things in mind, and that is very, very important. Above all, honor and integrity. Remember, we can cover up everything that we want. We can hide our failures. We can lie to the patient. But it all depends what is my personal code? What is my professional code? What is the standard of behavior that I will hold myself to? And there is a very colloquial way of putting it, and we often ask this: what would you do if this was your family member? How would you deal with this case if this was your family member or their life was at stake? And use that as your background to look at ways and means by which we can go ahead. And above all, having respect for others, not just patients and their families, but any other doctor, other colleagues, nurses, students, residents, all your staff, because nothing can happen without being part of a team. And even if you've seen those acronyms, together everyone achieves more. So if the person who's on security duty is not doing his job well, if the person who is responsible for cleanliness and sterilization is not doing his job well, it doesn't matter who is in the OT and who's the famous surgeon working there. If the entire team is not with him or her, the case is likely to be a failure. So let us respect each other's contribution. Let us respect each other's work, however minimal it may be. I may be the most famous surgeon. I may be doing the open heart surgery. But every single person in that institute helps me and contributes to the fact that I am allowed to do the surgery in comfort and without any disturbance. So again, a small video clip as we wind down today's session, and this is such a wonderful doctor, and let's look at it.
Are you kidding me? Wow.
I think something wonderful, so beautifully said. It speaks for itself. He had such a challenge in giving an injection to a baby who doesn't understand, who you can't explain, who you can't really comfort. So, what are the moral duties of us as a doctor? So, to help and cure, to promote and protect the patient's health, to maintain confidentiality of all the information that is shared, to protect the patient's life, to respect his or her autonomy, to protect their privacy, and above all, respect the patient's dignity, because everything flows from there. If I look at them as human beings, as members of my family, automatically I will do what is best for them. And remember, the patient also has certain rights. So, the right to getting high quality medical service, the right to having a choice, a chance to choose, to decide, to be informed, to ensure that whatever information is shared remains private. The right to being educated on their health, the right to being told of the benefits and the risks, and again, the right to being treated as a human being, the right to a dignified life. So remember, ladies and gentlemen, what we need is a change in our thinking, a change in our attitudes and beliefs. Only then will that change our behavior. Because once we change our behavior, we will see good results, and those results will naturally encourage us to think better and to think bigger, to introspect about things we've taken for granted, and to look at ways and means that we become better and better. So I think this is important, and I leave you with this thought that we need change. We need a transformation on so many different aspects of our life. And if we decide to change, if we decide that we are going to be better, if we decide that we are going to make a difference, and we are going to consider ourselves true professionals, then nothing can hold us back. So thank you for a patient hearing. With that, we come to the end of this workshop. Thank you all for being here. Thank you for your contributions. Thank you all for sharing your views. It really made it interesting, and I hope it was good for you all. If there are any questions or comments, then we will definitely consider them now.
So are you still in the college, Dr. D.Y. Patil Medical College? Are you there right now?
Yes, I'm there.
So I'm also a student of the same college.
Yes, Harsha, I recognized you. Tell me, please.
So may I come and meet you?
Yes, please do.
So where are you right now?
In the university building, third floor, finance department.
Fine. Thank you, sir.
Welcome. Yes, anybody else?
Sir, I have a query. Like, if we talk about a good communication skills, which we can practice in our daily patient dealing, and if you are having like a pretty heavy OPD or a lot of patient load, and you have very less time which you can deliver per patient, so like how do we manage it? Because if you don't have adequate time to understand the patient,
Yes.
so I think a lot of aspects, they get limited, that we can't
True.
deliver best.
True. Yes, Tanvir, a very, very important point that you mentioned. And in fact, we use this as an excuse to very often hide maybe our inadequacies. Remember that. We have to find solutions. This has been a problem for a very, very long time, and it is not going to go away. The fact that we have busy OPDs, the fact that our doctors have so many responsibilities on them, but we have to find solutions. So number one is to prioritize. Again, I understand that it is not possible to take even 5 minutes or 10 minutes to deal with one case and to put everything that we have discussed into that much time. So with experience, with the fact or having all your colleagues on board, we have to learn to do what is called triage. So triage basically means, even though normally it's used in emergency medicine or in the emergency settings, where you decide who needs immediate attention, which attention can be delayed a little bit, and thirdly, which attention can be delayed for a couple of hours. So that helps you decide when you have a huge rush of patients, or there is an emergency or an earthquake, or even during the pandemic, how you have to prioritize. So even in your OPD, an older patient, a patient who's just come for a checkup, a patient who just wants a change in his medication or wants a new prescription, they don't need that much of time if you have given them in the beginning. A patient, again, say, who comes to you and you've diagnosed it very simply as just a humerus fracture, or maybe it's someone with a sprain. They don't need that much of time, that much of communication. You can refer them for an X-ray. You can probably pick up the phone, tell the orthopedic department that I'm sending a patient I've already examined. He or she just needs a radiograph, and maybe if you can give her a temporary plaster and a date on which she can come for her permanent cast, something like that, and you are done with it. But where there is a new patient, where there is a patient, like I said, you're going to break bad news. Someone has come in, the test results are already on your table, and the patient is in your waiting room. You are about to tell them that he or she has tested positive for some disease. And their complete life is going to change. The lifestyle of that family is going to change. So identify such cases. Either you tell them that, listen, I need a lot of time to talk to you. I want to discuss with you. I can't do it here. So can you please wait? Or can you come back in the evening? Or can you come back tomorrow? So that will give you time and the space to deal with that patient. And then you can communicate in the way that I told you. You also will be at peace. You won't have 25 patients standing on your head waiting for you and who are going to complain that the doctor is taking so much of time. It's difficult. I understand that. I've been through the rut myself. We've had patients. I've worked in government hospitals where you had to see over 500 oral surgery patients in a single morning. So there's no time for niceties. There's no time for even being able to comfort the patient. But still, it had to be done. So that's why I said, prioritize among your OPD. Depending on which specialty you are, this would be a little bit more difficult or maybe slightly easy as long as you plan. So if someone is concerned about the surgery, somebody has a lot of questions, again, just defer them for some time. Say, can you please wait? Or again, an important means, remember, I told you it's overall communication. So maybe you can prepare a few handouts. Again, don't have a lot of written material. Make it more in terms of pictures. Make it more in terms of line diagrams and drawings by which you can explain to the patient what you want to say. So you can tell them that, listen, this is what we are going to plan for you. Say somebody wanting a cataract surgery. So you can have a small handout, you can have something like a small presentation on cataract surgery, on do's and don'ts and common FAQ questions. Of course, it has to be in the language that the patient understands. So you can give it to the patient and say, why don't you read this little handout that I prepared? It's going to answer a lot of questions that are there in your mind. After that, if you have any specific questions, I'm here, I will see you in half an hour. So you have bought yourself some time, plus 1 or 2 points that you may have missed are already there on that fact sheet or on that information sheet. So just one way, for me, say if somebody would need third molar surgery. So that's again a relative common occurrence, but it does have a lot of questions that the patient has in terms of when will it be done, what are the side effects, what will be the long-term effects, when can I eat, when can I come in. So a lot of these questions are common to almost 95 or 98% of the population. So you can serve them well with a handout. It adds on to the communication. Remember, you're not using that as the final communication. It's just an add-on. And then when the patient comes back, you can say, okay, I hope you have read that. Do you have any queries? And address that. It will save you time. It will be clear to the patient as well. And it makes it easy. Of course, it's a challenge. Understand, taken for granted. But if we make small efforts, I think we can slowly improve. Again, every specialty, please have charts. Please have little handouts like this. Please have small presentations running on the screens that are normally there outside most of your OPDs. Remember, the patient while sitting down there, one, has something to keep their mind busy. If they feel, okay, I have a lump or I have these symptoms, what is it likely to be? That can be reassuring in itself. So build up your communication to be in such a way that right from the time the patient walks into your institution, there is communication. They are ensured of privacy confidentiality. They are ensured of having someone to listen to them. They are ensured that as they come closer to the specialty that they want to, there is information on the walls. There is information in terms of handout. There is something playing on screen. So it's all communicating to them, and overall it is acting as a force multiplier. So it's making your job easier. It's ensuring that you spend less time with an individual patient and allow you to still communicate effectively and with a lot of empathy and keeping all the ethical principles in mind. I hope that answers your question to some extent.
Yes, sir. Thank you so much. It was a
Welcome.
very practical solution that you had provided. And I really wish that we could do something that we add on this communication skills to our curriculum, that students are taught this right from the college or maybe during the internship.
Actually, it's already been implemented, Tanveer. I don't know which year you are or
Yes, they are being implemented. It's called 8Com.
Yes, it's called AETCOM, AETCOM. In fact, I think 2 batches maybe now have, right from the time they join. I know the batch just probably the first part of COVID, 1920, or was it 1819? I think those who got admission late 2018, they were covered under that. So there is a complete module on communication, on ethics, on everything that is important, which you have said. So right from UG, of course, PG, this was always expected or built into the curriculum, but unfortunately didn't work out too much practically. But in case any of you would need further information or would like to attend similar workshops, we at the Department of Education of the International Chair in Bioethics have a lot of courses. We have a basic international certificate course. We also have a postgraduate diploma course that is likely to start very shortly. So you can just send in your emails to Dr. Shiv Joshi, or even put it in the chat box right away. And we will take note of that, and I will send you the information. Otherwise, also, I'll just put in my email ID there. Yes, so I've put in my email ID. Please feel free to send me just a testimonial and what exactly you are interested in. And I will send out the information to you today itself. Yes, any other questions or comments or anything that you need? It need not be directly or indirectly related to this workshop or to communication, but any other issues that you are facing, and if we can be of assistance, please do let us know. I'd like all of you to please type in a little bit of feedback into the chat, because it's important to me and to us as a team to know what was good and what was not so good. So please type in take a few minutes to type in your comments into the chat box so that we can improve as we go ahead. I thank Dr. Shiv Joshi and the entire team who has been working in the background and who has put this entire workshop together, the team at DigiShield. Thank you for giving us an excellent platform. We could communicate quite effectively, and look forward to seeing you all in the days ahead. And best wishes for the entire Ethos conference. So please give us some feedback. Tell us what you liked. We all say wonderful and good, but let's be a little bit more specific as to what was good and what was not so good, or what could be improved in the future so that we can get better each time. So thank you, everyone. Thank you, Dr. Shiv, for giving me this extra time, for giving me this space and the opportunity. Always wonderful to be here talking to you all.
Thank you, sir. I think communication skills have been a very important part of us as doctors, and the way you put it across using very practical approaches, specifically the spikes and the learning tools that you used, like showing those videos, was very relevant and an excellent way to communicate the thoughts on this. So thank you, sir, for that. And sir, the next session starts at 2. So Anna is going to conduct a workshop. If you want, we can wait till someone if anyone wants to speak, give an oral feedback, then please go ahead and you can share your experience. What do you think about the workshop? And if you think something needs to be done in a better way, that is also very encouraged.
Yes, please go ahead. Or like I said, you can always type it in the chat box. It's important because we realize we also have ways to improve, or that would be good. Thank you, Harsh and Mamta, for that feedback. Yes, it was helpful. Thank you, Tabitha, as well. Thank you, Lokesh.
Sir, can I share something which is not a part of the workshop?
Yes, please do.
Okay, so sir, I did some research on studying the perception of the onco nurses on the bioethics.
Yes.
So their knowledge was assessed and
Yes.
they were taken a workshop, and then the post-workshop knowledge was assessed.
Right.
So we had seen a drastic improvement in their knowledge when
Yes.
they had undergone the workshop, which was on bioethics and communication.
Yes.
So, sir, having said that, I just wanted to emphasize the fact that having a course of communication is really good. But what if we have a simulation, sessions or maybe some workshop, so that we have them after a set interval of time? So that will, reinforce the knowledge, and it will help the physician to bring that more into practice.
Tanvir, which institute are you with, may I ask, or what is your seniority level? Because I don't know that. Your
Sure, sir.
background.
Sure. So, sir, I've done my graduation from SGRD College, Amritsar,
Right.
and I've recently graduated.
Okay.
Yeah.
Yes. Okay. Okay. So first of all, congratulations on that.
Thank you so
We had come twice to your college. I don't know whether you remember me
Yes, sir. I have
from
attended.
there. You do. Okay. So thank you for that. Tanveen, you would have seen that, of course, this was pre-COVID. COVID really took a toll on everything we were trying to do. There is this effort that we have, because we realize what you said is understood by a lot of people sitting in healthcare management and a lot of people who understand this lacunae, even at the highest level, which is the National Medical Commission. They also realize this. Number one, that is why this entire module of the ATCOM module was introduced, where ethics has put into the curriculum. And again, communication skills, empathy, being able to understand confidentiality, privacy, there's a lot of emphasis on that. Even the National Board of Examinations, in a lot of the hospitals in which they conduct their programs, they've also been part of this program with us. And I think we've done about 6 or 7 workshops with them. The whole idea is that each one of us has to start this change. Only then it is going to happen. So I realize that you are just a young pass out, a young medical graduate, but remember what you do today, you are sowing the seeds for a fruitful crop later. So at your level itself, if nothing else, you can just ask for more courses. You can give feedback and say, this is what we need, and this should be organized more often. From my side, I can assure you that anytime you need a course to be conducted, because thankfully we have this digital platform, so distance and time goes out of the equation, and even organizing it becomes better. So please feel free. You have my email ID out there. Get in touch with me. Anytime you need a workshop to be conducted, I'm always there. And this goes true for any one of you. If you all need help in conducting a course, in conducting a workshop, that can be arranged. There's no problem. We don't need anything. We just need someone who's willing to listen and someone who has an open mind. So please, anytime you need, just let us know. You can organize a group of your students. You can speak to your faculty. You can ask for it to be done officially, and we will always do something for you.
Sure, sir. Thank you so much.
Welcome. You are welcome. Yes, Hima, thank you for that feedback. Of course, we love to have such workshops in person. And again, I had much more activities planned out, but time was of the constraint. If Shiv Joshi knows, I wanted 3 hours actually, because that is the minimum. And then again, because of technical difficulties, we started almost 1 hour late. So that's why I had to cut down a lot of content, because I realize there are practical issues. But this will not be the last. As I told you, if sufficient number of you are interested, you can always get in touch with me or Dr. Shiv, and we will put forward a workshop for you in the days to come. It's not just a one-off thing or something that we're going to forget about. We can take it forward. So just let us know. Send me your names, make a list, tell us who all are interested, and we'll get something organized. That much I can definitely do. Thank you, Deepika, and thank you, Mohammed, also. So kind of you to give me detailed feedback. Really appreciate it. Shiv, who is taking the workshop at 2? You're muted.
Sir, Anna is doing it at 2. Anna
Okay.
from Greece, our ISA member.
Okay, and what is her topic?
So she's taking it on social accountability.
Okay, all right. And is there one more after that, or that is the last for today?
No, so there are 4 more, I think. Yeah, three more after that, from 4:30 to 7.
All right, okay.
Yes.
So I hope all that information has gone out and they have all
No,
confirmed.
Sir, regarding Shabir, sir, I have sent out an email again.
Yeah,
Also
I
send it
saw
to you.
that. I saw that.
Yeah.
I'll just go through it. I think.
Others, sir, we already have a confirmation. Yeah.
Okay, absolutely fine.
Yes.
Okay. All right, I'll take your permission, Shiv, to leave, but since you're keeping this on, you can always share with me if there are any queries or concerns after this, and we will definitely work on that. So thank you everyone for being here. Thank you for a patient hearing, and look forward to interacting with you in the future. Bye-bye and thank you.
Thank you so much, sir.
Thank you. Thank you all for contributing. That's what made it good. Bye-bye.
Thank you.
Thank you. Thank you, Harsh. Thank you, Tanveen, and everyone else. Really good.
Thank you everyone for joining in, and thank you, Mamta, for moderating the session.
Yes, Mamta, thank you.
Welcome, sir.
I couldn't see you. I was looking around for you. I couldn't see you because probably you were quiet. So now you've come up. Thank you for that. Okay, bye-bye. Have a nice day, everyone.
Bye, sir. Thank you.
Bye-bye.
Piyush, we can close this session.
All right.